Boom, boom, boom. Hey, hey, hey. Thank y'all for coming out and joining us on another episode of Melanated and Candace, The Color of Truth. We are here today to talk about medical malpractice and how it affects us, specifically affects us in the African American community, Black community, beautiful people community, um, and how we are disproportionately mistreated as women when it comes to doctors and their treatment of us in the medical field. So, before we get started, I'm going to say hello to my lovely co hosts. Hi, ladies. How are you, ladies?
I'm good, but I am not looking forward to this conversation. This one's going to be a tough one. It's emotionally challenging to talk about this, especially as a Black woman. So it's a necessary conversation. I'm just not necessarily looking forward to it. But other than that, life is great.
And
The
then,
same. The same. That's exactly how I feel. It's like there's no other words. But how
okay.
you doing, sis?
No, I mean, all right, until we start having this conversation. And then I'm probably going to go pull out the Kleenex for everybody and mail y'all some tissues too. Because I definitely know, especially, going through what I just went through recently, how hard it is on us in the melanated community when it comes to healthcare and how they don't listen to us. That's been one of those things that has been renowned that I've heard throughout the research process is that they don't listen to us. So um, there was a article on Healthline online on healthline.com that said that in the US, 12 million people are affected by medical misdiagnoses every year. 12 million people every year get misdiagnosed. There was an estimated 40,000, 80,000 people that die every year just from complications from the mixed diagnoses. So, and then women and minorities make up 20 to 30% of those people who are more likely to be misdiagnosed. So, we're going to go into some statistics and stuff and get a little deeper into it a little bit later. But I just want to throw that out there that out of the people that are here, 12 million people every year get misdiagnosed by a doctor. Somebody tells them that it's something wrong with them that it's not, or they treat them for something that they don't actually have, or treat them for something different than what they actually have and end up hurting them in the long run. So we got some exciting stuff for y'all. We're gonna pull out these videos and get into those. We'll watch a video first. This video that we're getting ready to watch is emotionally charged. It's about 17 minutes, but we'll skip through a bunch of it so that we can get straight to the stories of the ladies that are inside of the video telling their stories. So we'll allow them to tell their stories first, then we'll talk about some stories that we've seen online, um, go into some statistics, and then we'll tell our own personal stories to close us out. All right. Now let's see if I can make this.
Get my box of tissue ready.
Looky here, looky here. Look, I'm over here like, let me see if I can make this happen.
Okay, so
Yeah,
listen.
so this is the video that actually sparked this conversation
Yes.
in watching this. And it was very interesting to see because oftentimes we go through these experiences in life and we think that it's only happening to us or we think it was a unique experience. But as you read more articles, hear more news stories, social media has taken over and big data is allowing us to see that a lot of these events are not one-off events. They didn't just happen to you. They're not anomalies. A lot of them are more, it makes you wonder if they are more racially derived. Or what necessarily constitutes what women go through as opposed to the versus between Black women and white women and what they go through seeking medical attention. But yeah, very interesting video. And it was very interesting to hear these women's stories as well.
So deep. So let me see if I can make it bigger. See if I can get us into the story. Get the volume up. Oh, look at
Never offered me any other
before. Okay.
Where it said doctors are to black women what police officers are to black men.
That's very compelling and very true. I almost died during my first childbirth, and they kept trying to force an epidural on me. And I think because I refused it, they never offered me any other pain medication. And I didn't know at the time that there were things in addition to that to help sedate you. The doctor came in, put something in my IV. I got super drowsy and I felt myself slipping away. I'm thankful that I meditate and all of that because I literally found myself in between worlds. I know it sounds cheesy when people say, oh, you're in this dark tunnel and you see the light. That is true. Whatever it was, they gave me way too much. And the doctor even told my husband at the time that I wasn't going to survive the delivery. Baby number 2 was fine. I would say I suffered the worst during baby number 3. They gave me the pain medication, but also induced my labor at the same time. That means they cranked up my contractions. And that's not even the full story. So I agree with that statement.
Red said,
So she was the first of the many people that are we're gonna see in this video that has some issues medically when it comes to doctors in the hospitals. Something that I can relate to. They definitely all the time decide that they want to crank your labor up and give you the pitocin in order to be able to jump. You're not going fast enough, so we're gonna go ahead and give you this medicine to bump your contractions up, and then we're gonna overdose you with the other medicine on top of that. So, because I was real nervous, they had given out, some of the drugs that they give out in the hospital are drugs that opioids, drugs that people are addicted to. So,
Narcotics.
yeah, yeah. So giving it to you and like the lady said, she felt like she was almost slipping away.
Right.
Out of body experiences.
And you know what, Roxy, it's funny that you brought that up because what I found interesting, and I found this out years ago, that medical schools now, they teach cesarean birth before they teach natural birth. Now, how crazy is that? And now
Ridiculous.
we're talking about inducing labor. You're taking too long. This is eating up too much of my day, whatever the case may be. So now we're back to them inducing labor, and more women are having cesarean section births as opposed to natural births. But how is it that the thing that your body as a woman was designed to do, why is it that we have so many complications that require so many women to have cesarean births? And your body was naturally designed to give birth.
Well, honestly, when you induce someone's labor, you cause the baby inside to have what? One, it could be a slower heart rate because you can decrease their heart rate. You're decreasing their oxygen and supply inside, or you'll speed it up, which both of them are detrimental to the child. Both of them are detrimental to the mother. Pitocin is that stimulant drug. It's something to kick it in. I've been on both ends. One, when they kick in Pitocin, don't give you an epidural at all. And they do that transverse on you when they want to literally take their hands and turn a baby around on the outside numerous times. So I totally understand what that woman, ooh, honey. Yes, they take us through the ringer, honey. And I didn't get no pain medication for that. So, yeah.
That was pretty tragic. Let's go ahead and take a look and see what the next story was about.
said doctors are to black women what police officers are to black men.
Going to the doctor as a black woman, okay. Sterilization. They're constantly driving you to make decisions that will impact the future of your legacy. Disbelief, minimizing your symptoms. Um, I would say even enabling certain behaviors and medications that may turn around and cause mental health issues later. Just things that would possibly debilitate you to the point that you are dependent on the system. I think that's what the healthcare system is really used for. So it makes it really difficult to get real health care.
Doctors are to black women.
So again, a lot of the stuff that she said in that story was true as well. They definitely make it hard for you to be able to trust doctors in order to be able to try to get some health care. They're always pushing, get your tubes tied, Oh, you got 2 kids. Oh, you got 3 kids. Oh, you got 4 kids. You need to get tubes tied. Y'all know I done heard that so many times. And honestly, it wasn't even until up until just recently, once I had my issue that I had with the hospital, with my malpractice, that I even considered it for real. I used to be taboo against it, but the way that they botched up the situation in the hospital, it makes you more inclined, because just on the strength of not wanting to have to go back through it with them again, because the hospital is tragic. They push all kinds of, and they know that a lot of those things, like birth control and stuff, has negative side effects. Um, Things that are geared to make it worse on your body. You know how you read about medicine that you take, and they always tell you that the benefits to taking the medicine outweigh the risks of actually taking the drugs. But then,
Mm-hmm.
but then you go down and you start reading all the side effects to the drugs that they got you on.
Right.
Start listening to him. I mean, the commercial, that's all that little person doing when he's talking fast. This may cause. I mean, he's literally telling you all the side effects, and ain't none of them positive other than the fact that whatever you got is going to stop due to you, quote unquote, taking that medication.
And the next thing you know, it may cause death, electric shock, all kinds of other heart problems, heart failure, kidney failure.
There is other medication, like the young lady said, when it comes to health care, in our birth control, we already know there are some of the things in the birth control, especially the shot and the patches and things. They add it's a hormonal, right? It's an extra hormonal, right? So they're bulking certain things up. You become a little bit heavier. You become a lot of women that I know, when they were taking that shot, they've gained like a lot of weight. And that's what it's adding on to you, that extra estrogen, that extra tocin, that extra oomph. That's what it's adding. But it also gives us the side effects of TD, which they never actually said it until it started being more in mental health issues. In mental health issues. Now we start taking medication for not only our birth control, but then we start taking medication for our mental health issues. So that's two things we're taking. Then we start getting all these extra side effects. So we started adding pills for the side effects that we take, that we're having. And that number one is TD, teledyskinesia, when you start to twitch. And a lot of people never understood, when they're taking mental health medication, why they're twitching. The twitching is coming from the mental health medication that they're giving you. It's the medication that it's giving you. Like TD is from the medication that they're giving you, which is the mental health medication, to stop you from, quote unquote, having bipolar depression, manic depression, or so on and so forth. But yet it still gives you other mental things such as suicidal thoughts. Well, hell, that person wasn't even having suicidal thoughts back then. They were just mood swings. You know what I'm saying?
And how can any medication where a side effect is thoughts of suicide, how can the benefit outweigh the risk?
That part.
Wait, some of the side effects include death. They be like, contact the person immediately if you have a heart attack, a stroke, a blood clot. I'm like, wait, if I'm having any of this stuff at this point, like, it never outweighs the benefit, never outweighs the risk. It's always something else that goes along that makes it worse off than it was before.
It's the short term.
Unless the benefits they're talking about are their financial benefits. Now, at that point in time, those benefits do outweigh the risk.
Absolutely. And they're definitely not,
because your life isn't important to them.
That part. And at that point, sometimes it doesn't, because that depends on what kind of insurance that you have, because they won't see you steal.
Right.
But you also know that the manufacturers will definitely cover anything and everything that patient may need to take their medication, though. So yet that insurance may not cover it. That's where that manufacturer kicks in and say, hey, guess what? We'll take care of you. We'll make sure you get that medication. Go ahead. Fill out our paperwork. We will pay for the medication to get to you. with all the side effects, but we'll make sure that you get the medication.
They'll send the medication out free.
Yes, that's exactly. And they'll send it out free because they get the kickback for taking care of a chronic patient in whatever shape or form that whatever shape or form that may be. Mental health is chronic, diabetes is chronic, hypertension chronic. You know what I'm saying? A lot of these are chronic things, so they manufacturer will take care of it. So there's no, that they never have to worry about medical insurance covering it because they will take care of it and they will get their kickback after they pay for it.
Oh, for sure. Or, I mean, if it's individual patients, guess what? They're going to bill Medicaid in your behalf and still get paid. For that medicine out here.
Right.
Right,
So
y'all.
go ahead.
Next.
Men, what police officers are to black men.
This is so true. They actually think that Black women don't go through pain. When I was pregnant with my second son and I was actually going into labor, my doctor was on vacation. So a peach colored doctor, male doctor, came in to help me with the delivery. And my uterus, anybody's uterus, only opens up to 10 centimeters. My son's head, the circumference of it was 13 centimeters, and he literally stuck both of his hands in my vagina and tore me with no medication. They don't care. They don't believe that we can feel pain just like anyone else. They don't feel like we go through those things like that. So yeah, it's true. There are kryptonite.
And you know what's crazy about that is she talked about, and this is a current day story. She talked about how they don't believe that we feel pain, and in she was talking about Black women. And what's funny about that is that is centuries old. You've got what's his name, Mariam Sims, who basically gynecology. He's the father of gynecology, and part of his research, what we know as gynecology today, stemmed from his experiments on Black women, from enslaved women, and a lot of it was because they documented that Black people didn't feel pain. They weren't subject to all the things that or the uncomfortableness that white people were subject to. So a lot of the things that we know today as gynecology was because of Marion Sims. We're gonna talk about him a little bit later too. But it's funny that she said that today because they love to talk about how things are different now, how we're not disparaged against now. But these are modern day stories of women talking about what they're going through today. And it's indicative and it mirrors everything that was happening in the 1700s and the antebellum era and all of that. So it's crazy that she said that, but they want to sit up. Of course, I would Biden and Kamala, America's not a racist country, but go ahead.
Now, a thought that I had on that was just the fact that, oh, Lord Jesus, 10 centimeters, they could have gave her an episiotomy, but the fact that, peach color came in there, and there's numbing medication for that. There's the episiotomy, but I mean, yet and still, that head was going to split. But I couldn't see you putting your hands. What, man?
That's what I was gonna say. Why do you stick both hands up in there, though?
That's what I'm saying. Like, there is no way in the world that 10 plus your hands, bro. If you don't move, you ain't even getting your fingers over here because I'm about to punch you.
That added 4 centimeters to the problem. Like, you slid your hand in there.
And you had exactly
both.
Man.
That's what I'm saying. So you're doing like this inside of already 10 centimeters, bro. You split me from Rudy to the Tootie when they say it.
They make equipment for that, though. So you didn't even have to you didn't have to stick your hand in there and do all of that. You could have just used some steps and pull the baby out. There's a whole process for that. But they're not following protocol. They are not following the processes that are set forth in these hospitals when it comes to caring for their patients. They just out here gambling with people's lives.
I'm caring for some patients, not all patients, just some.
Oh yeah, some patients' lives.
You gambling with a lot of patients that ain't the right, shade as you. Period. Y'all roll dice and play.
Ain't nobody got time to be playing like that.
I knew that was about to happen.
Okay.
I knew that was about to happen. That's why I kept on going. Like, I knew that's about to happen because it's only bound to happen.
Because I was trying to get through it so I could skip it.
Yeah.
It was going to happen in the middle of it anyway.
I'm trying to get to the next story.
Are to black
You
women
went back way
what
too far.
police officers are to black men.
Oh,
You went back too far.
Yep.
Go to the doctor.
Are to black women what police officers are to black men.
This
This
coffee
is
is the
so
bomb.
true.
Having my son. If I tell you that these people did not treat me with the same,
I waited in the waiting area.
trash.
I am sorry. I am sorry.
Doctors are to black women what police officers are to black men. So my question
Yes, this is going to be a long video, so I need you to stick around. Back in October of 2019, I was 2 months pregnant. I went to the hospital because I felt like an elephant was on my chest. My husband dropped me off because he was with our oldest son. I waited in the waiting area after signing all my paperwork to get started. I told them that my chest was hurting, I could barely breathe. I started crying and I started screaming. The nurses looked at me through the glass and did nothing. This Indian woman who sat next to me went to the nurse's glass and began to bang on the glass and told them to come help me. They finally came out, wheeled me to the back, took my blood pressure, took my oxygen levels, and they believed that I had pneumonia. They brought me to a back room where I waited another 2 hours with no help screaming because I could barely breathe and it felt like my chest was collapsing. After 2 hours, somebody came and got me, brought me to the room where I stayed overnight. My husband could not stay. Multiple doctors came in and said that they needed to contact my OBGYN, who was a doctor at that hospital. Nobody contacted her. They gave me no medicine to stop the pneumonia. About 2 a.m. in the morning, I felt like I was being strangled. I called my OBGYN on the phone at 2 a.m. to let her know that I felt like I was dying and nobody in this hospital was helping me. A nurse came in and said that I was having a panic attack. I was not having a panic attack. My OBGYN showed up and said that nobody, not a single doctor, had called her. She recommended that I got a CT scan where they would not do a CT scan on me because I was pregnant. She said that my life was more important at the time. They did a CT scan and find that I had a double pulmonary embolism that almost killed me. From then on, I had to be on blood thinners the entire time I was pregnant. Had
Oh
my
my,
doctor not come to that
you would have
hospital
died
and demanded that I had a CT scan, I would have died.
that night.
None of the male doctors believed me. None of the white female doctors believed me. My Indian OBGYN who delivered my firstborn believed me, and she saved my life. The black nurse who knew that I needed an oxygen mask saved my life. When the white nurse said that I was only having a panic attack and I was being irrational. This is why I had a tubal ligation. Also, black women, if you ever feel like you have pressure on your chest, please demand a CT scan.
doctors are to black women
Oh, yeah,
That
that one was
right
hard.
I'm gonna tell you what's so crazy about that though. If for our viewers who don't know what pulmonary embolism is, that's a condition where one or more of the arteries that are inside of your lungs become blocked by a blood clot. So she had a blood clot that actually was blocking in her lungs and had took over in her chest and was probably getting ready to explode and take her out. Um,
mm-hmm.
and they was just gonna let her die.
Of a panic attack.
Because they always assume the mental health, because a lot of African Americans, people of color, melanated people have always been on birth control at a young age. So then you think, since we've been on birth control at a young age, quote unquote, now you're no longer taking birth control, you're no longer on birth control, you quote unquote still have a mental health issue that you never addressed due to the birth control that we were taking that gives us mental health issues. You see what I'm saying? It's like it's, man, listen, they was gonna let that girl die that night, period.
Yeah.
Right. Over a panic attack, according to them.
According to them. It's always according to them, like they know. Ooh, honey. Okay. Yeah.
Panic
Go
attack.
ahead, my bad. That's why I gotta turn this camera off real quick because that peed me off that quick.
Ah, well,
And to just listen to her and just automatically assume it's a panic attack without any research, without any testing, without anything. Oh, you can't breathe. It's just a panic attack.
They
When
did
did
this.
we get to this point? And that's so different from what happened during C-19. I will never forget. During C-19, I was one of the people that wouldn't. I didn't want to fool with too many people because half of y'all nasty. And I called, so I did the teledoc thing, right? Because all I needed, and I wasn't sick. I needed my medication prescription refilled. So I wasn't going to bother going to the doctor where they were handing out COVID and take those chances. So I said, you know what? I'm just going to do the teledoc, tell them to go ahead and refill my prescription, and that's going to be that. Do you know when I called? Now, what I was getting refilled was asthma medication. So, of course, that means you experience periods of shortness of breath because that's what asthma is. So, because of that, I told the doctor, I was like, hey, I'm running low on my asthma medicine. I feel fine. I'm not having an asthma attack or anything. I just know that I'm running low and I can't take a chance of not having any of my inhalers. So, of course, I happened to cough while I was on the call. Well, because I coughed on the call and because I was replacing asthma medicine that indicated that somebody was experiencing shortness of breath, do you know that they diagnosed me with COVID? I had never taken not one test. When they sent me my email of my medical diagnoses saying that they would refill my asthma medication, they put on there that I was diagnosed with COVID. How? Because I coughed on the phone and
But
because I was
asthmatics
refilling a prescription for asthma, which is indicative. I've had asthma since I was 11 years old, which is indicative to periods of shortness of breath. How did you attribute me wanting to refill a prescription when I clearly told you nothing was wrong to say I had COVID? So not only are they under-diagnosing individuals, like clearly what they did to her, but they over-diagnose individuals as well.
that's crazy.
Absolutely.
But I had that removed from my medical records.
I was about to say, but you know, that was just helping their numbers out.
I had that removed from my medical because I don't have no damn COVID and I ain't trying to be a part of your stat and you ain't
exactly. I'm about to say, state that. I don't want to be part of your stats either. Go ahead and remove that up off of there because I'm not part of your numbers.
Right. I wasn't tested for anything. How you just gonna put on my medical records that I got COVID because I'm refilling asthma medication?
Because you
so they under and over diagnose all the time.
All the time.
That's crazy.
It's crazy because I've been in her predicament too, but I've been in, in the hospital just waiting, waiting to be seen.
Forever.
I had just lost my son. So I was just waiting to be seen because I felt like I was going to die. Like I'm dying, but anytime you're telling them and explaining to them or just being however you're feeling, they're like, oh, you're exaggerating and you're extreme. Man, listen.
It's not that bad.
Yeah, exactly. And I felt my body just coming out and like kept going out and coming back in. I'm trying to tell, my husband then like, hey man, something is going on. But it takes that man sometimes to stand up and be like, hey, hear me now. Or that second person to come in there to help save your life because they will ignore the crap out of you because they got other things to do, which is basically nothing. Because, honey, you'll be amazed what they be standing back there doing.
Right.
Eating, talking, planning their weekends. Absolutely nothing when it comes to the patients outside waiting in the waiting room.
Nothing at all. That's so sad.
That's why I don't like really going to like doctor's offices and things like that because I know how y'all playing with people's lives. Like I know how y'all doing it. I don't got time for you. But go ahead, my bad.
Oh no, you all right. You're fine. That's what we here for.
Like, it's pulling my little strings, man. It's pulling my strings for real. Like, honey, I got some stories for that ass. Yeah. Especially how they just try to play my father too.
Okay.
Well, thank everybody for coming out and joining us today. Definitely make sure you like, share, and subscribe to our channel at Melanated and Candid. If you want to support us, you can also support us via Cash App at Melanated and Candid as well. I'm going to go ahead and I'm going to pop this next video.
What police officers are to Black men.
Definitely true. When I had my second baby and I was on epidural and anesthesia, and so she's pushing the afterbirth out of me, and she leaned my bed back and she popped my IV. We heard it, but she didn't know. I was like, what was that? But I'm so in love with the baby. I didn't know until like 10 minutes later, there's blood all over the floor. And yes, I was in a room full of white nurses and doctors. And I thought about it while I was having the baby, like, wow, all these white people, nothing wrong with it. But yeah, that showed me that they really don't pay attention to what they're doing. So when she leaned my chair back, she started pushing on my stomach. She popped my IV and I was bleeding all over the floor. And then literally no one knew until it was like a lot of blood, and then the whole room went into a panic. I didn't need no extra blood. I didn't have nobody in there with me because I had my baby during COVID. So definitely bring an advocate with you and advocate for yourself.
I have a genuine.
That's real. I'm gonna tell y'all.
Oh my God.
That's real. If I didn't have somebody at the hospital with me, if Eric wasn't there with me, then I would have died, y'all. I would have died. Do you hear me?
Mhm.
I would die. Like
you gotta bring somebody to advocate for you, especially when you're in a messed up situation and you around hospital people. Like, they don't care about you. They waiting on their check, period, point blank. They're not there to really care.
But as a people, we don't think about stuff like that because we automatically assume that they are there to help us. You go to the doctor in order to be able to be treated. They take a oath that they're going to make sure that you're safe and that you're well, to do the best that they can in order to be able to take care of you and keep you alive. That's not what they're doing. They are not caring at all about us, our health, our feelings, none of that. All they worried about is getting paid. And depending on, like I said earlier, what kind of insurance you have is going to determine how hard they're going to work in order to be able to help you. Like
that part too.
Yeah. Yeah. But it's crazy that you talk about, they don't care about your health. They only care about fat in their pockets. And we know that to be true today. But it's not just about fat in their pockets. It's about the racial disparities, because all these are Black women's stories. I mean, this whole video is about what cops are to Black men is what doctors are to Black women. And it's true. There are so many Black women who have so many horror stories and experiences in hospitals. How do you trust those organizations? How do you trust that institution to care for you when there are so many stories out there where we have been ignored, we've been overdiagnosed, we've been underdiagnosed, we haven't been treated with the same care as our light, fair complexion counterparts. And like I said, it's countless story after countless story after countless story. I remember when they overturned Roe, when they were trying to get the Black woman vote, and all the women got to go out and vote. And of course, the Black vote is always important when it comes to politics and them getting their way. So they ran a story that I think it was in DC, that they said Black women have a higher mortality rate, a birth mortality rate than white women do. And what was funny about the story is the way they tried to approach the story. It made it seem like it was about ailments or genetics when it involved Black women. And really what it's about is the disparities in treatment of Black women versus white women in the hospital. So when Black women are dying at a higher rate, it's not because you have a genetic issue that is causing you to have complications at birth or whatever the case may be. It's because of the lack of care that you are getting in the hospital, and you're more likely to be overdiagnosed, or your symptoms be ignored and you just there suffering in whatever it may be wrong with you.
Absolutely. It's always with the care, even the prenatal care, that during care, while the baby's in the womb. There's a lot of things that happens that need to happen. And there's a lot of things, check up and all that, but they don't do, they don't pay attention to them, nor do them. They don't follow the necessary monthly protocols. They're not, like I said, I'm not saying they're all in for checks, but most of them in for their checks and their money. Like, period. Most of them are in for their checks and their money.
And throughout history, they've been doing it for money. When they were experimenting on Black slaves during the antebellum period, that's what it was for. A lot of the displays that were happening in the 17 and 1800s were for profit and gain. They were displaying Black people, anybody with birth defects, abnormalities, somebody born hermaphrodite, things of that nature. So they were finding all the melanated individuals that had these birth defects, not that they only impacted us, but they were finding all of the melanated individuals that had these birth defects, and they were putting them in freak shows and circuses, putting them on displays and all this type of stuff, all for profit. they were performing surgeries or procedures, experiments on the enslaved Black people. They were buying Black people for these procedures. And you also had slave owners that were taking their slaves to the hospital for care, because their slaves, if they weren't in a healthy condition in order to be able to perform, to bale this cotton, or whatever the case may be, or to fight, whatever the case was, then they were taking you to the hospital if they had invested too much in you. They wanted you to be well, not because they cared about your well-being, but because they needed you healthy enough to perform a task. You needed to be healthy enough in order to do this job. But what was happening in a lot of these experiments, where a lot of these doctors were, not only were they trying to experiment to find cures for certain things, but they were also performing other procedures, and they weren't always doing it for the benefit of the patient. A lot of it was for medical research. So you're conducting experimental procedures on individuals during the antebellum period, all while you're having a classroom full of students observe this medical procedure that was not necessary. One of the things they wrote about was a kid who fell off a tree, I think, and he had injured his genitals. Well, they took him to the doctor to get repaired. The doctor treated him, cured him just fine. But then they decided to go a step further. The doctor, what they did was they experimented on what is it? The chloroform. So he was writing a paper on the effects of chloroform. So chloroform is one of the things, and ether is one of the things that they use to say that Black people didn't feel pain. So they would put the chloroform and the ether on Black people's noses and stuff. They would pass out. They would perform these procedures, and then they would come to an hour or two later. They use that data to actually suggest that these individuals don't feel pain, and that ether and chloroform were acceptable methods for anesthesia. So this is what they were doing. They were just passing you out. It wasn't anesthesia. They were just passing you out and performing medical procedures. So what they did to this little boy was they actually castrated him. Didn't tell him what they were doing. They castrated this little boy. And later what they did was he wrote a story on how chloroform was effective on castration. Yeah.
That's crazy. First of all, how do you castrate my son and I not have a problem with that? Let's start there.
But you got to remember, during the antebellum period,
back in the day, it don't matter. Just because he's your son back in the day, it don't matter.
That's what I'm saying. During the antebellum period, literacy amongst Blacks was outlawed. So you had a lot of parents that were taking that maybe wanted care for their child, or after slavery in the early 1900s, who wanted care for their children. And so since they didn't know how to read, they were basically signing, they would, just put an X right here. They were taking that as parents' signatures who didn't understand what they were signing because they could not read. They were classified as illiterate. And they were performing these procedures on these children, saying that they had consent from the parents.
On children, people, babies, quote unquote, the ones that went to them, fought the wars for them. Yay. You don't know how to read. We'll just tell you, hey, sign your name here. We're going to help you out. We're helping you out. And then they're experimenting on them. They're killing them.
Right.
They're still doing that right now today. They're still doing it right now today.
So many other ways.
Right now, misdiagnosing people, killing people, erasing people, for no reason at all, just in the name of science, in the name of medical science
and research.
They still bringing all of these extra doctors and nurses in to witness them doing all sorts of stuff to you that's supposed to be private. It's just sad.
So yeah, remember, you don't always have to have, when you're at a doctor's office, you don't always have to have someone or a group of young ones because they new to the practice. You don't have to have them in your room.
Yes, you can.
Just remember that you can say no to a whole lot of things. And they can say, well,
bring somebody with you.
I'm denying that right there. I'm not denying care, I'm denying that right there though.
Right. But bring somebody with you who can speak on your behalf, somebody who cares about your health and well-being, because there are going to be moments where you may not be able to speak on your behalf.
Say that. Ooh, I got a story about that too, but go ahead with this one. I got a story on that. When I wasn't able, but you'd be amazed at things that God help you talk and help you go through when you in them hospitals. I'm telling you, you'll be amazed when you can put them people in their place.
All right, let's catch the next one. Oh.
and that I would probably no longer have children. And it's true. So
Just about a second or two, yeah.
Okay, y'all. I am so sorry about this video being so emotional. I never planned for it to go this way. I promise y'all. But yeah, let's continue.
Where it said doctors are to black women what police officers are to black men.
and it's true. So as a young lady, I had an ectopic pregnancy. I went to the hospital. The doctor that I first had, which was a woman, basically told me that I had to go have surgery to have the tube removed because it
Officers are to black men.
Sorry, y'all.
And what police officers are to black men.
What happened?
and it's true.
Let me hit the.
Okay.
So as a young lady, I had an ectopic pregnancy. I went to the hospital. The doctor that I first had, which was a woman, basically told me that I had to go have surgery to have the tube removed because it was not viable and that I would probably no longer have children at all. Came to terms with it. Asian doctor comes on, male doctor says, "Why are you having the surgery? You're a perfect candidate for the shot." And I said, "Well, the previous doctor told me I had to have the surgery." He says, "Oh, you don't have insurance." And I said, "Yes, the fuck I do." And he says,
Say that.
"Well, she thought you didn't have insurance and that you couldn't afford the lab work afterwards. And that's why you were going to have the surgery. The bitch was going to take my tubes because she thought I didn't have insurance."
Wow.
You want to take someone's tube because you thought that she didn't have insurance.
Anybody tell your punk ass to be thinking? Excuse my language. See?
But hold on. If the individual's there,
Why
why
you
shouldn't
ask
you just ask?
motherfucker? You couldn't ask a
I was
motherfucker?
going off my bed, and I was on mute.
How do you decide? So let me get this straight. You wanted to take a tube because you assumed somebody didn't have insurance. Who was going to cover the cost of the tube removal? So
She
whether
was.
she had insurance or not, but that's what didn't make any sense. So
Yeah.
you were going to go through this procedure because you assumed this individual didn't have insurance. So whatever they were in there for, that their insurance would have covered. Either way it goes, there's a cost of going to the hospital. I don't care if all they do is give you a Tylenol and send you on your way.
That
It's a
part.
lot of money for
You
that
can
damn
pay
Tylenol.
$25. You can pay $25 for a hospital Tylenol pill.
That's
I know because it happened to me. You're gonna pay $25 for a hospital Tylenol.
Mm-hmm. Yes, ma'am.
So whether you have insurance or not, if a doctor sees you in the hospital, there's going to be a bill. So how do you decide to take a part of an individual because you assume they don't have insurance?
Because that part was going to be studied on. So they was going to take it, make sense. So they get their little reimbursement. So we get to play with this because we took it from you because you didn't have insurance. So we get to play with this. This is our little toy. We're going to figure out how to do this. And if it moves and if it shakes and grooves, we're going to figure it out because that's what they're going to do. They're going to play with it. That's why they have plans on taking it out.
And you know what? I'm glad you brought that up because if anyone has not read the book Medical Apartheid, I highly recommend every person of color read Medical Apartheid. It's basically the history of blacks being experimented on for research. Most of what we know today in medical research is because we were being experimented on. Everything we know about gynecology pretty much is because black women, enslaved women, were being experimented on. But another thing that happened after the antebellum period, during and after, was grave robbing. So a lot of the historically black cemeteries, they were actually robbing graves in order to be able to experiment on these bodies. During periods of slavery, they had states that would pass laws that would tell a slave owner, if you have a slave that dies on your plantation, you have to donate that body for science. So not only were they robbing graves, they had laws that slave owners had to turn their any dead slaves over for research. They were researching on those bodies. They were taking people who, there was a story they wrote about in Medical Apartheid about a guy who went to a chemical abuse. I think it was like a AA, whatever they called it back then.
Mm-hmm.
Because he was in there, apparently he didn't have any identification on him. What they decided to do was they decided to transfer this man. They basically kidnapped him from this substance abuse facility, took him over here to this hospital. He ended up dying, and they started performing research on this man. All because he checked himself into a substance abuse facility. But
Because
being a person of color, right? Being a person of color,
said what? If you die
exactly.
with us, guess what? You are
Right.
ours to study and research on.
Right. And that's another thing. Even today, you should not go anywhere without identification on you, because that's another thing. There was a law that they passed that said any unidentified bodies should be donated to science or sent to the universities and all that type of stuff.
That's what
To be
Jane
exactly.
Doe. Jane Doe, John Doe law.
Exactly.
Yeah.
Exactly. So when they have unidentified individuals, you're being donated. So they wrote about this one guy who also something happened to him. He passed out on the road or something like that. And he actually had an identification card, a contact for somebody in his family. Well, of course, that magically disappeared. This was back during slavery or whatever, or right after slavery. That magically disappeared. And of course, he was kidnapped or whatever and used for science. The family started looking for this individual. They were calling the police. They were calling everybody. And of course, nobody could find him. But of course, the police didn't do their due diligence. They never called around to the hospitals to check if anybody had showed up there with that fitting that description. They never called around to anybody else to see if this individual had showed up. They just basically kidnapped this man, set him over in a hospital. While he's in this hospital dying because nobody's treating him. After he died, they donated his body because nobody came to claim this individual.
But I can't claim something I don't know where he at.
Exactly. But now, I mean, now you have technology has changed. Now you should know where people. You shouldn't go anywhere without somebody knowing where you are, or at least who you're with, last place you've been, something of that nature. Now, when I say don't go anywhere without letting somebody know who you are, I don't mean go on social media and tell everybody that you're out of town. But somebody close to you should know about your whereabouts, because anything can happen, and not have an ID on you could lend you to being an experiment. Could lend you to being one of those individuals that gets admitted into a hospital as a Jane or a John Doe. And who knows what's happening to you after that? Because there are studies out there that show that Blacks are the highest contributors in organ donations. But Black people aren't necessarily saying that they want their organs donated. But if you're a Jane Doe or a John Doe, you don't get a say in that matter.
I was going to ask that question just as a side thought. When it comes to organ donors and death, do you think that they take a less risk in helping you if on your paperwork it says that you're an organ donor? Do you think when you go into the hospital, they automatically are like, oh, you're an organ donor.
We got an organ donor.
We just gonna go on and let her go.
Right.
Nope. That's why I'm not an organ donor. Unfortunately, I'm not giving up no organs and none of that. I'm going to be cremated. I'm going to make sure the person.
I agree.
I'm not allowed to mess with my body. I'm
because of grave. Because of
grave robbing. Right. First of all, you got to understand the grave robbers. They wasn't before they was grave robbing. They was just going in. You'll have your funeral service. Remember, you'll have your funeral service. We'll have the person. Remember, we'll put the dead body down. We'll throw a couple of pieces of dirt. The family leave. We'll pull the body back up. Boom. It's not, you know what I'm saying? You're not digging up nothing. Y'all just pretty much do that little piece for them people to leave. And as soon as they leave, y'all pulling it back up like it never even happened. Y'all are giving those bodies to research and science. So before they really started grave robbing, as in digging in the middle of the night, digging through all that dirt, they was just doing it the way that they wanted to. Have a contract with the funeral service. As soon as that body go down, bring that bad boy up and bring it on over here. We'll pay you the full price for whatever you know what I'm saying? That's that black market.
Right. You know what? Speaking of grave robbing, you all know about the 16th Street Birmingham's church bombing, right? Mm-hmm. Where the 4 little Black girls died in the church bombing.
That they studied on too?
Everybody knows that story. What a lot of people don't know about story is one of those little girls who died in the story, Addie Mae Collins. Do you know that? So after the incident, all the girls were buried. Martin Luther King delivered the eulogy, all of that. Most people know that story. The story that a lot of people don't know is about 30 years later, one of her sister, Sarah, they hadn't gone to visit the grave because it was just too painful. Well, 30 years later, they decided to go and visit the grave. Well, of course, it was covered in all this. I mean, it was just overgrown. Nobody had been tending to it. So she wanted her sister to be buried somewhere else where they tend to the lands, better. Well, so they had the funeral dig the grave up because she wanted to rebury her sister. When they dug the grave up, there was nothing there.
Period.
For 30, so this body went missing. This was in 1998. In 1998 is when she dug this body up, and there was nothing there. There was no grave site, nothing. So in 1998, this icon, this martyr in the Black community, one of the girls in 16th Street bombing, your body comes up missing. And you gonna sit up here and tell me that Ray Robin isn't, where was this body at?
It's in science and research. Remember, didn't they find it in the science and research?
Check this out. They claim they came back, I think it was in 20, I don't know if it was 2015, 2016, somewhere around there. And they claim that they may have found the body. They claim that they thought that the body may have been buried, I guess, behind the headstone, which was BS, because you know what? You know a story I never found? That they performed DNA testing to prove that it was her.
Exactly.
Right.
But if I'm not mistaken, there's another story very similar to that. If I'm not mistaken, it could be the same. That body was actually donated to a local hospital. I mean, a local.
That's what the families were saying. But later, when they had some kind of whatever that team was that did some kind of surveillance underground, they found what they claimed to be a casket that appeared to be of a small child that wasn't properly positioned to the tombstone. That's what they claim. But what was funny about that is they kind of killed the story at that about, oh, now the family has closure. But that story does not include DNA testing to prove that that was that individual. So if the casket wasn't where the tombstone was, who is to say that this is who this individual was? And not only that, why did it take y'all so long to find that? If in 1998 is when it was discovered that this body was not here, why wasn't it until 2015, 16, whenever it was, you said, oh, we may have identified the body? If it was just, I'm not understanding what took y'all so long to identify that. I don't think that was her. But I never found a story where they reported that DNA testing had been conducted to prove that that was Addie Mae Collins. And to this day, I still believe that body was donated to science.
It absolutely was. I remember one of them that they were talking about, a body that was donated to science to see. I think it was how black lung or something like that was it was from a fire, and I know black lung had something to do with the research and study of it. But it was some young black people getting burnt up. I also remember how not even thinking about that. Think about being buried, right? That's like apartments. In my mind, it's like a whole bunch of apartments, underground apartments. And you already know that the ground is shifting and changing. So if the ground is shifting and changing, who was right here may not be right here no more. They might be down the street because the ground is shifted and changed it. So,
I don't think it's that. A long time ago, most of my family wants to be cremated. I'm so glad. But a long time ago, when I made the decision that I would rather be cremated, I made the decision after visiting cemeteries. People in your family die, you go to cemetery. What I noticed in walking through cemeteries, I pay attention to my surroundings, was that unless you're in a historic museum or a military museum, none of the tombstones really go back that far. So if what we know is 2,000 years, it's 2022. Millions of billions of people have died before
exactly.
us. If everybody who died that was buried remained buried, there would be no land for the living.
Exactly.
I've always been one of those people who, even without the stories of grave robbing, even without all that, I've always been one of those people who just assumed that, okay, well, after they allow a generation or two to pass, they dig your body up, toss you to the side, and put another body there 10 years later. I've always just thought that, because I challenge you to go to a cemetery that's not a historic cemetery and tell me what's the oldest tombstone you see.
You won't find too many old ones. They get rid of those tombs. Like, they honestly other than the fact that they always getting destroyed or somebody's going over there beating them, destroying them. They're getting rid of them. That's why I said I would never want to live in an underground apartment complex. That's pretty much how I see when you get buried. It's like an underground apartment complex. Instead of you living in a high rise, you living in a low rise. I do not want to be living in one of them. Burn me, cremate me, baby.
Right. because I don't want to be used for your science. And most of that, and I understand the importance of the development of science, but my issue with being used for your research is the history of mistreatment amongst blacks in your research, and I just don't want to take no part in that.
Period.
So cremate me. Matter of fact, everybody I know, if something happens to me, when the coroner show up, just tell them to bring a match with them. We don't even have to go through all these other searches. Just tell them to bring a match. Then set
That's
me
what
on
I'm
fire
saying.
right here, right now. We don't have to, because I want proof that I've been cremated. First of all, I'm not going to be donated for your science. I don't want to.
I did actually when I did give my son to a to to a black funeral service, so I got everything. They even cut the baby's hair and everything for me. Did the footprints and just everything that the hospital probably could have did, should have did, or whatever if they cared. So yeah, I totally feel you.
All right, we're gonna catch this next video.
And I had a maternity.
Don't touch nothing else, Ross.
Do something to you.
Right, you already
just
scared.
because of the hatred they have for you because of the color of your skin. To someone doing something to you mistakenly. But feel free to correct me if I'm wrong at the comment section below, because why not?
Said doctors are to black women what police officers are to black men. So
Absolutely. I've talked about this a few times about my experience getting sterilized, but I want to put y'all onto this fuckery I witnessed this week. So I'm a makeup artist, right? And I had a maternity shoot this past weekend. This woman was about 6.5, 7 months pregnant. I do the makeup, I leave so she can change. I come back into the room and she's laying on her back, rubbing her stomach on one of the benches in the room. I'm like, yo, are you good? Like, are you okay? And she goes, yeah, my kid is like moving my hernia around. I just have to push it back in. What? A hernia. She goes, yeah, after my first pregnancy, I got a hernia and the doctors wouldn't fix it. So now it's a problem for my second pregnancy. What? That is potentially fucking dangerous to her and her baby.
Yes.
So
Having a hernia adds fluid. It could possibly add fluid inside the womb of the baby. That's what?
And how do you decide what was the justification for not removing it? How do you make that decision to not remove a hernia?
I don't know, because I mean anything that's protruding out, especially she's talking about her belly button. That's that had been an umbilical cord hernia. So that's the one that you do push back in, because she can anything could get in there. Anything can get stuck in there. That's the one I got.
That's crazy.
That's the one I got. I ended up having to get it in a big old car accident with Alana. But yeah, you definitely got to get that set. Like they have to fix you. But it's also you advocating for yourself. Why can't I get it? Why? What makes me not a candidate? You got to ask why. I don't go for the okie doke on nothing. You got to voice your own, like, why? Tell me why. And then I want to ask somebody else, because I don't want to talk to you no more. Let me talk to somebody else. Why? Like, I don't know. I never could have been me. I'm telling you, baby.
That's crazy. So, real.
What happened?
So what I was getting ready to say was, so we got a lot of other YouTubers that are on the show. You guys, thank y'all so much for coming out and supporting us on our show. If you do have a channel, a YouTube channel that you would like to post up in the chat, you can post a link for your YouTube channel in the chat.
You can't, Roxy. You can't unless they have a wrench.
But you better stop gang banging, though. I love you.
Hey, y'all can get out, Poppy. I got you, Poppy.
Yeah. Don't gang bang.
Okay, Poppy.
I got you, Poppy.
Please, sir. Hey, hear me now. Don't be gang banging over here, but I love you though.
You can always send it to us.
Don't pay her no attention. She just talking shit. I got you, Poppy.
We'll post it so that other people can come out and support your channel just the same way you come out and support us. We big on support, and we appreciate y'all so much. Definitely, if you're new here, make sure you like, share, and subscribe to our channel at Melanated and Candid. You can do it here. You can do it on Facebook. You can do it on TikTok. You can do it. Um, and you can support us via our Cash App at Melanated and Candid as well.
Yes, Supreme Team, it is. Medical practice is so real. And it is definitely running rampant and crazy in the women community as well as the Black men.
It's just not as obvious as it was during slavery or antebellum period or early 1900s. It's just not as obvious, but it
Not as
still exists
recorded.
today. Because these
Not
are
as
women,
recorded.
but
Me
even
just
then,
go to the
even
doctor.
back during the antebellum period, it wasn't recorded as often as it should have been, because a lot of what they did was when they started getting the scrutiny, because we would still be enslaved if it weren't for those other white folks. So we're not finna sit up here and act like Black folks are the reason why we free, because we ain't the reason why we free. So there were other white groups of individuals who did not agree that Black people should be mutilated, that we should be experimented on, unless it was voluntary. And a lot of people had a problem with Blacks going through involuntary surgeries and procedures as forms of experiments. So as they were speaking out, of course, they were all being shunned, they were being quieted. None of their articles were being published. So what they did was, even since some of these things were becoming a little bit of knowledge and more people were talking about it, they started covering their tracks by relabeling Blacks. Instead of just calling them Blacks or calling them enslaved individuals, they started calling them the urban community, the poor community. That way you didn't have to associate poor to Black, because there were poor whites that were experimented on too. So they started relabeling them as just poor, just urban, so that way they can get away from the racial biases. But it was still happening, because if 75% of donated bodies or organs came from the Black community, but even during slavery periods, the highest population we had was what, 30% during slavery? So how did we make up 30% of the population at our highest, but we're 75% of the organs and bodies that were donated for research involuntarily?
Well, you got to understand, most of the statistics and the numbers always is totally wrong. Because I'm
not wrong, a lot lower than they actually are, because a lot of stuff has gone underreported.
There we go. They always misconstruing some numbers, because I'm gonna tell you now, there's a lot of melanated and melanated and colored individuals, and it is just one solid non-colorish humans. There's a lot more melanated and colored individuals than it is one solid.
Right.
Let me see.
They've been taking, and not right. And even after slavery, they were taking freed men. And you know what? They actually, what a lot of people don't know about the medical community is that medicine made slavery attractive to a lot of freed slaves, because one of the things that they were doing in this whole propaganda campaign was, when slaves were freed, a lot of them, of course, were disadvantaged. They didn't have the property, they didn't have the finances, they were basically starting from nothing. So if one of them fell ill, they didn't have access to any kind of medicine or any kind of care. But a slave actually did have access to medicine and care, because their slave owners wanted them to be healthy in order for them to produce. So it was more visually acceptable or mentally acceptable to be a slave. That way, if you fell ill, at least you could depend on getting some kind of care, because your slave owner wanted you to be healthy. So medicine attributed a lot to slavery, is what a lot of people don't realize. It made slavery acceptable amongst Blacks.
It's sad. It's sad. The stuff that we willing to accept in order to be able to continue to be mistreated is sad to me.
Right.
I saw a meme on Twitter where it said, "Doctor."
So what's happening is we have a bunch of new age James Mariam Sims running around and getting their degrees and becoming doctors. These people have admittedly said that they don't believe Black women when we rate our pain and things like that. So ladies, make sure you educate yourself.
A house or a laptop?
Oh, right.
Which one do you think is worth more? Well, definitely not the house, because it not only costs.
Pretty much
advocating for yourself and other young Black girls as well, because these doctors do not have our best interests at heart. Or if you can, get a Black doctor. Okay.
Where it said, "Doctors are to Black women
I was glad
what police officers
that she
are
brought
to
up
Black."
James Mariam Sims, because when we decided to have this conversation, that was one individual that I did want to talk about, was James Mariam Sims. So when I watched the video and I saw somebody actually bring it up, I was so glad that somebody knew who he was. But for those who don't know, he is actually what they call the godfather of gynecology. He is the one that was buying slaves for to run experiments. A lot of there was one procedure. What is it called? Vesico-vaginal fistula, the pendulum, all that stuff. He created a lot of those procedures, but he was doing it on unanesthetized slaves, whether he bought them or whether he had contracts with slave owners that said, okay, if your slave falls ill, you can bring them over here so that we could conduct these experiments. We're looking for medication to cure this. And a lot of what they were trying to cure had nothing to do with Black ailments. For instance, so everyone knows about the Tuskegee experiments. Well, a lot of Black people were diagnosed with syphilis. There were a lot of illnesses that were raging in the Black community. But what they failed to uncover was that in these researches, they found that a lot of this was attributed to lifestyles and the way people live. So it was about people being dirty, not having access to clean this, healthy foods, not bathing regularly, whatever the case may be, living in filth. But the people that were living in filth, so you tried to make it seem when it was reported that Black people were filthy individuals, and that's why they had these illnesses and ailments and genetic traits. But in all honesty, the reason why Black people were filthy was because they were living on the part of the soil that was less beneficial to everybody else. That it was the worst part of the land. They were living in shacks. They didn't have the proper protection. Everyone knows that they were given scraps for food. So, and a lot of what they did was when they were trying to get after slavery, when they were trying to get the Black community to volunteer to be practiced on or experimented on, they would do things like entice you with fancy foods and things like that that Black people were not accustomed to. So they basically made slavery, even after slavery, when they abolished slavery, it was only abolished in name because they continued all of these practices with the free slaves. Again, they used propaganda to make slavery look appealing to free men. They made the military look appealing to free men because men in the military had more access to medicine than free men, because free Black men didn't have the finances for access to medicine. Not only that, there were laws that said Blacks and whites weren't mingling. There were a lot of places where Black people were not admitted. There were a lot of hospitals that would not allow a Black individual to come into that facility. So if you're a Black free man and you fall ill, not only did you have to find some place where you could be admitted, but you had to worry about whether or not they would actually treat you the way you should have been treated, whether or not they would just allow you to suffer so that they could experiment on you, or even if they wanted to treat you. Because I do believe that there are some doctors who actually wanted to treat individuals, but because they believed that we didn't feel pain, they ran experiments on us, even when they were trying to cure illnesses without anesthesia. They would tell the story of one doctor said he amputated a Black slave and he didn't feel any pain. You gonna sit up here and tell me this man didn't feel no pain and you done sat up here and cut his whole leg off?
How do you know how that man felt though?
Exactly.
Right.
I was about to say about the godfather of OBGYN. Right. How do you know what a whole uterus or anything feels like? Boy, I'm telling you.
But yeah, Mr. Mariam Sims, yeah, he is the reason why gynecology is what it is today, because of the experiments that were ran on enslaved women, whether he purchased them for research or whether he had slave owners that were literally bringing their individuals to him. What it was their bed winches that they needed to be healthy and all that type of stuff. So they were literally donating their slaves for research. And one of the issues that they ran into was this idea of consent, where they would try to say that these individuals were consent. But how do you consent when you're a slave? Where does the ability to consent come from when you are enslaved? So it's not that they consented, but they didn't have the right to refuse. So because you don't have the right to refuse, they call this consent.
And today, and in the 21st century, the same thing happens. If you say, no, I don't want that, they say, oh, well, you're refusing care. No, I'm not refusing care. I'm refusing what you're doing right now, though. I don't want that done right now. And you can definitely advocate for yourself I am one to do it. Trust and believe. Yes, you
That was
can.
another thing. That was another thing they did during the antebellum period too, and during the Tuskegee experiments, is they were saying that Black people would not voluntarily. They don't take care of themselves. They're too illiterate to take care of themselves, or know they need help. They won't ask for help. So they use that to avoid the consent conversation, even when it was brought up that, oh well, we have to care for them because there's when you're in the hospital and you're under a doctor's care, if you cannot speak for yourself and nobody is there to speak on your behalf, a doctor is making a decision in what is supposed to be your best interest.
Exactly.
Yeah, because my best interest and their best interest ain't the same
It's
thing.
not the same. Exactly. And
They
even
don't
if it
look at me
is, even
if they
if it
count
is,
it the same
but
way.
even if it is, Roxy, if I have cancer, I don't want to have cancer. If I want to rid myself of cancer and my doctor wants to rid my cancer, we can have the same end goal, but that don't mean I'm volunteering for all of these procedures. I don't want chemo.
Right.
So even if we have the same end goal, it doesn't necessarily mean that I'm consenting to any procedure you want to perform. But
Exactly.
None
if
of
you're under, but
them.
if you're doped up, you're out of it, you can't make these decisions. And if no one is there to speak on your behalf, they're still doing what they were doing with slaves during the antebellum period. They are still making those decisions because you don't have the mental capacity, whatever the case may be. You're too illiterate. Whatever it is, they find any excuse to make those decisions on your behalf. And when they're not making those decisions on your behalf, your symptoms are basically being ignored.
Yes, they will try. You better tell me your mama illiterate. You better get the hell away from me. Excuse my language, y'all. I'm just saying, y'all be amazed at things that I've been through in the hospital. So yes, I'm just telling y'all, advocate. There is nowhere in the world
Right.
you know I don't want that done. Or if I question you when they come in and get to messing with your IVs and don't want to talk to you and they just feel like they coming in and do your job. Bet you don't. Excuse me. Wait a minute. Hold up. What are you doing? You supposed to tell me what you doing to me as you coming in here. What medication are you giving me? How much are you giving me? Let me see what you're doing. Let me see that syringe. Let me see how you can ask them. You can be involved with your health care. You can be
Be involved with your health care or they gonna treat you any old kind of way.
But there are individuals who can't have a say so in their health care. Everybody who's jailed, criminals, they don't have a say so in their health care. There's a story out now. I can't think of what it's called, but it's a documentary on the female prisoners in California, how they were being what they were being sterilized. No say, just mass sterilization. Matter of fact, one of the things they talked about in the book of Medical Apartheid was during the 50s and 60s, welfare recipients. So as Black individuals or Black women started to get welfare services, they would do these little roundup things where they would go around to all the welfare recipients, of course, in the melanated community, and they would see, of course, one of the rules were you couldn't have a father staying there. So if they found a man residing in those households or dwellings where the government was subsidizing you or taking care of your lifestyle, what they would do was, if you didn't want your services to stop, if you didn't want to stop receiving those benefits, you would have to agree to being sterilized. You would have to agree that you wouldn't bring any more children into this world that they would have to take care of. So as they're going through these roundups, and they were only doing it in the melanated community. They were sterilizing women because they found men in the homes.
No, these women was allowing them to sterilize them because they ain't want to get up and get out and get something.
Exactly.
Why
am
I making a decision about whether or not I'm about to receive this $232 a month from you for these 3 kids that I got? I keep my child's father in the house. Like, why are me and my child's father not getting together and making a plan so that we can take care of these kids without you?
Right. But see, that's why I've always had a problem with welfare services, because they're not there to improve your situation. They're there to keep you in a rut, and you will forever, like the book said, slavery died in name only, because welfare services is indicative to slavery. Prison, indicative to slavery. Almost all institutions today is indicative of slavery. The school to prison pipeline is real. The single motherism to criminality is real. And that's a prison pipeline too. I'm sorry. If most of our social issues come from fatherlessness, then single motherism is a leading cause in criminality.
Yes, it is.
But we're pushing that you notice how it's being pushed in the Black community. Every Black woman can be strong and independent. And my problem with it is, when you read everything that's happened throughout history, how do you not look at what's happening today and realize that everything has changed, but not shit has changed? Only thing that's changed is technology and wording.
That part.
The practices have remained in place. What's pissing me off is that you have people that are volunteering for these practices today unknowingly. Anybody that's a welfare recipient is volunteering for these practices. And a lot, if you, just like I say about when they were talking about all the police brutality, you want to get out here as a Black woman and say we need to protect our Black boys, but you're the first one putting them in the system.
That part, because if you get on welfare, they going in the system.
Right.
Welfare want their money back.
Right. Right. So but yeah, a lot of Black people don't have a say today in what kind of procedures are performed on them.
A lot of them have a say today to deny the procedures that are done to them. They just have to be educated in what's going on with them, honestly, because you can always, again, refuse certain services.
But if you don't have access, so they always recommend you get a second opinion, right? If you don't have if you barely have access to the one doctor you saw, at what point in time so poverty plays a huge part of this. At what point in time does somebody with limited resources, limited transportation, have the ability to not only be educated, but get multiple opinions and see alternating or different doctors to determine what is going to be their best cause, to determine what procedure they actually should go through? These people are not being educated by the health system because it doesn't benefit them for their patients to be educated.
No, they're being educated by people like me, outreach, social services.
So poverty plays a role.
Being an advocate.
Poverty plays a role in medical malpractice. Yeah. And that's one of the reasons why I don't understand how you can have some Black individuals who don't believe that the reparations conversation needs to happen. If poverty plays a huge part, even during slavery, this was the issue. When you had the free slaves, so a lot of them volunteered to do the labor. A lot of them went back as free men. A lot of them went back to plantations to work the lands as free men. So what they would do is what they paid you would be crumbs, and what you were paying to eat or whatever you were purchasing from them was, of course, inflated. So it was keeping you in a poverty state. Mm-hmm. Because they weren't paying you enough to survive, so they kept you in poverty. A lot of systems today are in place to keep you in poverty. If poverty is the leading cause of most of these issues, if poverty is the reason why we don't have access to proper medical care, then how can we not have the reparations conversation? How can you not say that is due to us to at least make us whole on that account? If poverty is the reason why a lot of these things exist. Another thing that they brought up. Huh?
They're not going to do it, though. We definitely need to have the reparations conversation, but they're not going to do it. They don't consider us to be a complete human in order to be able to give us reparations for money.
And that's
the reason why everybody else has got their money and we haven't, and we still waiting.
And that's why they're okay with putting us last. That's why they're not worried about our health care. That's not, that's why we're always going to be at the bottom of the tadpole, even though we are the majority in the United States. Anything of color, let me say it that way, anything of color, when you got a color, melanated in a color, there's only so many of those with single, and it ain't a lot of them. It ain't a lot of them. We are the majority, and we still get the less of healthcare.
Because we are 3/5 of a human.
But you know what? That was another thing that they talked about. So everybody knows who Margaret Sanger is. Everybody knows she believes in eugenics. And people can say that she didn't believe in eugenics with the Black community only, but that's bullshit, because there are countless stories of things that she has done. She was strategic in her speeches that don't outline Black eugenics, but her actions indicate eugenics in the Black community. Exactly. What was that?
No, I was agreeing. There you go, sis. You're right. Go ahead.
Yeah. So back then, everyone's talked about eugenics. One of the things that was talked about back then, and post antebellum and during the antebellum period, was the term mulatto. So mulatto was something that was created back then when slave masters were sleeping with the black women, and they were having these mulatto babies and all of that. So mulattoes have always been a problem in the Black community, which is another reason why I cannot support SYSBM. So one of the things that they believed was that in this mixing, because back then, they had a problem with the Blacks that were considered passing. You were so fair skinned that you could actually pass for one of them. A lot of people didn't like the idea that the Black community was starting to get lighter and lighter shaded because of the mixings of Blacks and whites, that a lot of those were starting were going to pass. They got to a point where they were actually having conversations about, if we continue to allow this procreation, not only with Blacks amongst Blacks, but Blacks amongst whites as well. They actually talked about, we're going to become a minority. Pretty soon we're going to be more Black or more just people of color because they're mixed with Black. No one is going to be pure white anymore. And so we talk about how everything has changed, but nothing has changed. So in today's environment, you got white individuals that are talking about birth replacement amongst white individuals. So not only were they talking about it back in slavery time, but they're still talking about it today. And so anybody who supports that SYSBM, where they want to go out and date all these women of other nationalities and other cultures and other races and all that, and the women who choose to divest, the biggest problem I have with that is you're repeating the slavery mentality. You are buying into the idea that Black is bad. You're buying into the idea that not only have they always viewed us as America's target, America's greatest target, America's problem child, the problems in every community is always Black. Everything negative is associated to Black. For Black people to get to a place where Black men don't want to fool with Black women and Black women don't want to fool with Black men, it just brings back all those stories of, okay, are we really agreeing to a soft genocide of our own people? Have we gotten to a place that whites don't no longer have to push their agenda because we're doing it for them? No different from the abortion rate. During slavery times, or even during Martin Luther King's time, there were talks about Black people needing to procreate more, and we need to procreate to the point that we get to at least 30% of the population. They actually talked about this. But if you look at the abortion rates, nearly 40% of abortions are coming from Black women. So are we pushing their agenda on their behalf? Have we gotten to a place that we're so detached from history, we're so stuck in today's environment of technology, that we don't even realize that we are pushing that agenda? We don't realize that we are actually agreeing to a soft genocide against our own people. Another thing that they talked about back in the day during antebellum period, where they identified people with vertigo and what is it? The when you have the pale skin, I get albinoism. They talked about those conditions. Now,
when the same
albinoism. Yeah. So they talked about albinoism and vitiligo. Now, back then, it was associated that those were all Black illnesses and ailments and things. What they didn't realize was that these happened amongst whites too. It just wasn't as noticeable in the white community. So they actually had people that were talking about, you know what, we could cure slavery if every Black person had vitiligo, if every Black person had albinoism, we could actually rid ourselves of slavery. So every time I hear somebody talk about SYSBM or divesting, that's what the hell I think about. You're pushing their agenda. Is the only way to rid of racism in America to actually rid ourselves of the Black race.
And it's crazy that you say that. That's why so many of them went to co-mingle and co-jingle with us, right?
But there are a lot of people for it, a lot of people against it. My problem is the Black people who have decided to divest from Black people. It just takes me back to these stories where this is everything they talked about during slavery, was eliminating the Black race. This is what Margaret Sanger stood for, Black eugenics. But we're taking care of that for them because we're so busy stuck in our emotional phases that, because he cheated on me, I don't want to date Black men. Or because she did this, I don't want to date Black women. We are pushing their agenda for them. So we can talk about the medical malpractice, we can talk about the racial biases, but we also have to take some accountability for how we contribute to that agenda.
That part.
True, but I could tell you now, we ain't contributing to them flamming us in the doctor's office.
Oh, hell no.
I mean, you know what I'm saying? We ain't contributing to that part. We ain't contributing to them wanting to always go in and take your blood over and over and over again, and ain't told you why they keep taking your shit.
You can stop them from doing that. That's
yes,
that's where that advocation comes in at.
Period.
Stand up and say something. You don't have to keep letting them take all of your blood. You don't have
to. You do not. No, you do not. You do not have to allow them to experiment on you. I was a person that was in the hospital for a very long time due to them not knowing what was wrong with me, but them not listening to what I'm trying to tell them. You know what I'm saying?
There are stories today where doctors are saying, oh, they can't make a decision. You can tell them that I don't want to do that. They will put in your chart that you are not of sound mind to make that decision for yourself. No, if you go to a hospital as a melanated individual, take somebody with you to advocate for you, to speak on your behalf.
Yeah, they won't say that you're mentally incapable. What they will say is that you're refusing care. So that's their thing of, if we can timeline your refusal of care, this part, regardless of what you're saying, you're still refusing what we're trying to give you. So your refusal of the care, of the care. So then that's their way of timelining and helping their asses, covering their asses, so to say, because every time they're saying they're going to do something and help you, you're refusing their care. So then they'll say, okay, well, we're dismissing you now because you refused our care. You know what I'm saying? So like I said, I've been one in there to when they just kept coming in with just normal, just different things. It's like, wait a minute. Ain't none of that my problem. This is my problem. This is my issue. Let's address the problem and the issue. And they just keep going around it. You have to make them focus on, no, you is not listening, Linda. Like, and if that, and that, listen, I've been known to call, listen, if you ain't Linda, I'm calling you out your name because you is not listening to me. So I've been one of those, they say irate patients, but no, I'm not irate. I just know my body and I know what you're not going to do to me.
That part, regardless of something is wrong with me.
Yeah, like I know something is wrong with me, but you're not just going to keep experimenting and poking on me and just doing whatever. And that late, and I literally had a nurse in there, kept telling me to stop throwing up after she has a tube down my nose, to my throat, down my stomach, and you telling me to stop throwing up.
Because you can control that. Like,
what? Say that. Right? I looked at her, I said, what? She said, stop throwing up.
I'm heaving, choking.
Girl with the whole tube down my throat, down my nose and everything. And I'm looking at her like, you keep doing this, we're going to have to put you out. I said, with my nose and everything, no, bitch, ma'am, hear me now. You get out. I need you to go. Because this is not working. And you can't make me stop throwing up after you pouring this stuff down my nose to my stomach. It's not working. Right. It's not my fault. That's not refusing of care. I'm not doing this on purpose. My body is reacting to what you're doing to it. So you can't argue with me. I need you to get up out of here, though. Because I'm about 3 seconds from beating you up with this tube down my nose. I'm like,
girl, I had a doctor tell me that I was refusing care. So there was a period where every single year, like clockwork, I caught strep throat, right? And this is when I was on a lot of asthma medication. I caught strep throat every January, like clockwork. Well, after year 5, when I went to my doctor, he said, hey, I'm noticing that you're getting strep throat every year. He said, if you get strep throat again, I'm going to recommend that you have your tonsils removed. Mm-hmm. So I'm like, well, I've always been one that I'm not voluntarily going to let you cut on me unless it's going to be extremely beneficial for me. So I asked a bunch of questions. And one of the questions I asked was, if I allow you to take my tonsils, will that for sure guarantee that I will never catch strep throat again? Because I know that the tonsils serve a purpose in your throat. They keep down infections.
Yes.
So I was interested to know how you removing something that keeps down infections was going to help me to eliminate an infection. When he answered me and said, no, I can't guarantee that you will never get strep throat, but it should eliminate your chances. I said, well, if it's not going to eliminate my chances of getting strep throat, why the hell would I let you take something out of my body that's designed to help keep me well? So I'm going to make myself subject to other infections because I let you cut my tonsils out over strep throat. This doctor actually told me, he said, well, are you refusing care? No, I'm not refusing care, but this is going to be the last day you're going to be my doctor. And that was the last day I saw him.
Refusing care.
But what was interesting, that was when I started. But prior to then, I wasn't reading a lot of ingredients or doing the research on the medication I was taking. It was after that's when I started reading labels and looking up side effects.
There you go.
One of the medications that I was taking for asthma increased your chances of having infections of the throat.
Exactly.
So the doctor knew that I was on that medication. As a doctor, you should know that it comes with the side effect. So when I read that, I said, you know what? I'm going to wean myself off this medication. I wean myself off that medication. Do you know I have never had strep throat again?
Yep.
So you're going to cut my tonsils out because of a problem that was created over medication that you prescribed to me.
Yep. That's exactly how they do it.
Medication to me that caused me to have strep throat, and you wanted to cut my tonsils out because of it? Nah.
But as you would have kept taking that medication, regardless of your tonsils being taken out, you would have got a different type of infection now within further down, because it's going to now affect your esophagus.
Right.
It's going further down because there's no tonsils stopping it from, taking the sickness out, which kind of holds it, which kind of like that tonsil would be that thing that kind of holds the strep so it couldn't go further in your system. So
I still have my tonsils. I'm just saying.
I know that's right.
I'm sorry, because if it's not going to prevent it, why would I go under the knife? I don't understand the benefit of that. Yeah. And I'm glad I did. And I promise you, I was so glad that I started looking at my medication I was taking. And one of them was actually contributing to my catching strep throat. And ever since I weaned myself off it, I have never had strep throat again. Ever.
That's
medical malpractice.
That's exactly what it is. Misdiagnosed.
Misdiagnosed.
But you prescribed the medication to me that was causing me to have damn strep throat.
But he didn't care about that. I still got to make some money, so let me go ahead and figure out another way so I can keep you.
That's because the benefits outweigh the risk, okay?
Not my benefits, and that's why I fired him as my doctor. That was the last time I saw him.
Yes, you have to. You have to. You. The thing about them is it's always about making money, and like I said, if you are anyone that took birth control at a young age as a teenager, it does psychologically start affecting your brain mentally. Yes, you do end up having mental health issues, but it's stemming from the birth control that we were taking all these years, or as many, a lot of people been on birth control since they were like 10, 11, 12. You know what I'm saying? There's people that, you get on birth control soon as you start hanging out with too many boys type of thing. You know what I'm saying? So it all contributes to your mental health. So if you was on any type of birth control, mental health is definitely stepping in. Any type of mental health medication you start taking, I'm going to tell you, TD is going to be one of your number one side effects. And if you want to stop having TD, you have to start weaning yourself off the mental health medications that's giving you that TD.
Yeah, you're right, Supreme 10. You can't make this shit up.
You cannot.
Said doctors
I've had a lot of horror stories, and that's why I don't trust the medical. My bad, Rob.
Oh no, you all right? I was trying to get it to the right point.
I knew she was.
Go ahead.
I knew she was like, oh, let me slide it real quick.
I was over here doing too
as well, because these doctors do not have our best interests at heart. Or if you can, get a black doctor. Okay.
Rich said doctors are to black women what police officers are to black men.
So unfortunately, this analogy is 100% true. And it's mostly true because Black women aren't being listened to when we go to the doctor. We're being easily dismissed and our concerns aren't taken seriously. And medical students, it's still believed that Black people feel pain at a different rate than white people, and our skin is thicker and our nerve endings are thicker, so we don't feel pain. Studies show that when there's a lack of racial concordance between the patient and the doctor, they are less likely to ask questions, less communication happens in general, and our concerns are easily dismissed. And you can look at the maternal mortality rates for Black women and see that it's true. And if you did want to try to find a black doctor, only 5%, really 4.7% of doctors are black. So good.
This is crazy, y'all.
Good luck.
This is
She
crazy,
said
and
good
people need to
luck.
do better.
Good
I
luck.
think
That's
she was
why
the
I tell
last one,
people
right?
do birth, do
Yeah,
home birth.
Like,
so she
share,
was our last one.
subscribe if you have.
Home
Right.
births are the best things to do. I tell people invest in a home birth, in a doula, or I mean, unfortunately for me, I decided not to have no more. I'm done. Take me out the race, home skillet. Leave me alone. Don't touch me. I don't want not near one soul. I'll be damned. So yeah, but for others, I say doula, or there's what I'm saying. We've been having babies, and having babies anywhere. Keep it 100. You know what I'm saying? We've been having babies anywhere and everywhere. There's people in different countries having babies right now, outside, in the river, in the lake, in the ocean. You got to explore your avenues of having a baby. There's many different other ways, midwives, different things like that.
Oh, James Mariam Sims. So yeah. This clown. So
Probably
you want to take it, Rocks? We just read through a couple of the first part of it and go down to some of his criticisms and all that type of stuff.
ain't nobody ever offered that man not near one cum cum bomb clot. Now I'm just gonna say that, but you go ahead and read it.
So yeah, so you can take it, Rocks. But this was the guy that the lady in the video had brought up about. You have a lot of modern day doctors who believe in this whole James Mariam Sims ideology, and a lot of them still do. But he, like I said, he was a guy that he was the godfather of gynecology. But go ahead, Rocks. Oh, I got it. All right. So James Mariam Sims was an American physician in the field of surgery known as the father of gynecology. His most famous work was development of surgical technique for the repair of vesicovaginal fistula, a severe complication of obstructed childbirth. He is also remembered for inventing Sims speculum, Sims sigmoid catheter, and the Sims position. Against significant opposition, he established in New York the first hospital specifically for women. He was forced out of the hospital he founded because he insisted on treating cancer patients. He was instrumental in the creation of the nation's first cancer hospital, which opened after his death. He was one of the most famous and venerated physicians of the century. In 1876, he was elected president of the American Medical Association. He was the first American physician to become famous in Europe, and he openly boasted that he was second wealthiest doctor in the country. However, one would be hard. Someone stated that one would be hard pressed to find a more controversial figure in the history of medicine. A statue in his honor, the first statue in the United States in honor of a physician, was erected in 1894, but removed in 2018. Go down. Did we lose Rocks? Okay, there she go. You can keep going, keep going. I want to get to some of his controversial past the education. We can pass that. So okay, stop right here. So attacks on Roxy, go back. Go back. No, Roxy. Go to the top of back to the attacks. Right here. Attacks on defensive Sims. Now thank you. All right, so criticisms. So Sims' primary interest was not healing the women he experiments on, but in building his reputation as a doctor. And that was one of the things that they did talk about in the book, Medical Apartheid, that a lot of what we know today is for gynecology or even any kind of experience, a lot of it had nothing to do with them actually healing individuals. They were doing it basically for them. They were doing it for students. They were doing it for research. And it had nothing to do with the desire to actually heal the patients that they were experimenting on. Sims also conducted experiments on enslaved women without their consent. And of course, you can argue that consent was given, but how can consent be given when you don't have the right to refuse? Consent can only be given if you obtain the right to refuse. So that's always been something controversial. Also, he did not use anesthesia because he did not think that enslaved women suffering was important. So not only did they not believe that blacks didn't experience pain at the level that white individuals experience pain, but they also believed that the pain that they did experience was insignificant. So one patient almost died from a sepsis caused by a sponge left at the bladder entrance. And that's another interesting thing too. They talked about the child mortality rate during slavery periods. And one of the things that they didn't point out was, of course, they pointed out the fact that there was a higher death rate amongst Black women than white women. There was a higher birth mortality rate. But one of the things that they did not identify was that the reasons why for a lot of these mortality rates or a lot of the deaths was because when children were born, you know, when you had to sever the umbilical cord, they were basically taking dirty rags off the floor and wrapping up these babies. So you got a umbilical cord that has just been severed and you wrap it up in a dirty towel that's been discarded on the floor. That's no telling how long it's been there. So while they were reporting that there were high instances of these things happening or the child deaths happening in the Black community, they weren't reporting the reasons why it was happening in the Black community. And it was because of the disparity in treatment. It was because they weren't receiving the same care, not because of Black illnesses, not because of any kind of genetic formality or anything like that, strictly because you were not receiving the care that your white counterparts were receiving.
Exactly.
Sims also forced Black women to assist him in his experiments as white doctors would not. So that was another thing. When he opened up his hospital, there came a time where a lot of his staff walked out on him. So what he did was, with a lot of the enslaved individuals, he actually made the enslaved women participate in assisting him in his experiments. So not only was he experimenting on these women, he was making them experiment on enslaved women as well. He was forcing them to participate in these experiments. He experimented 30 times on one singular woman. 30 times on one person. Some of them were medical procedures, but still, how do you conduct 30 procedures on one individual? How do you experiment on one person 30 times?
Exactly. You can barely do that on one, you know, I mean, 2 procedures on one person, and especially within a 24-hour period. Like it's too much. It's too much.
It didn't have anything to do with healing the woman. It was about research. It was about them being lab monkeys, test dummies, whatever the case may be. That's all it was about. It was for their medical research, had nothing to do with healing. No different from the Tuskegee experiment. When they were experimenting, when they were running the Tuskegee experiment, they were taking men that had syphilis. That's another thing. A lot of those men that had syphilis actually didn't have syphilis. What they were testing for was some kind of nutrient or whatever, something in your body that created different types of infections. One could have been syphilis, no different from what was going on during C-19. The test that they were administering to determine whether or not you had C-19 was basically an elevated flu test. That's pretty much all it was just an elevated flu test. So you were running all of these experiments. You weren't getting, these women weren't volunteering for these services. And it was a huge issue, but it got to a point where Black people, when they started falling ill because all this word was getting out, they started telling their slave masters that they didn't want attention. They didn't want any medical procedures. But of course, you were considered property. So regardless of how you felt about it, regardless of your pushback, regardless of you saying, no, I don't agree to this, because you did not have the right to deny or the right to refuse, you didn't have the right to consent. So consent was based off of your slave owner. Go ahead. You saw something interesting?
Oh, that is a vaginal spectrum. I thought that was the one that they crank up to start paying attention to your vajayjay. I thought it was, but I'm looking like, well, wait a minute. That ain't the crank. So basically, it must be flexible back in the day to where you can kind of bend it, or they just, because ain't no way in the world you just, it's like this. You can't, that claw is kind of big. So it had to bend some type of way just to get it just a little bit before you pop it open, because there's no way you jamming it in there. Yeah, but there's no, you know what I'm saying? That's the only way that bad boy, scroll down. I'm just trying to see it one more again.
We can experience pain, so that didn't matter. And the little pain that we did experience was insignificant to them.
That's why, and you know what? It's funny that you say that, because I do remember being in a hospital numerous of times hearing them say, wow, you take a lot of pain. Wow, I can't believe that doesn't hurt. Wow, it's
Right.
like it does hurt, but I'm trying to channel
Right.
something a little bit different when it
But
comes to bringing
even
it. You know what I'm saying?
even if you have a high tolerance for pain, and I can't say that that's a black thing or a white thing, as opposed to just some people just have a high tolerance
It's
for pain.
just
I
one
feel like
person.
I have a high tolerance for pain.
It's just one
However,
person.
if if you can say that there are studies out there that suggest that blacks have a higher tolerance of pain than white individuals, if that study is accurate, how does an individual that has a higher tolerance for pain, how do you become a lesser individual? How do you say I'm inferior? I'm superior to you, but you can withstand more than me. So how does a person who
Exactly.
has a high tolerance for pain get to
Exactly.
the
Because you
bottom of the
know I'm
totem
a
pole?
goddess. Listen,
Not
you know
true,
I'm a
though.
goddess.
That's not
And if I'm
true.
taking life,
Right,
Studies don't show that. Studies show that we have a
right.
lower tolerance of pain.
But
So
even if we did, if that's the case, why am I beneath you?
exactly.
Why
You
are
know
you
I'm above
superior
you.
to me if I can take more than you can take?
You know I'm above you. That's why you're trying to belittle everything that comes out that comes your way, especially when it comes to
Right.
me. You know
Right.
I'm more
They've been
superior.
infatuated with black bodies. Part of this whole thing of that black people were abnormal, a lot of part of it came from black men genitalia. So a lot they've been obsessed with black bodies since the beginning of
Mm-hmm.
time. So one of the things that they tried to say that made black people abnormal, or you were some kind of uh,
Different.
creature, or you
Mhm.
know what I'm saying, was because you had larger penises than white individuals.
Yup, you was
So
inhumane.
y'all been jealous of cock sizes. I don't even
Mm-hmm.
know if I can use it.
But you
Y'all been
and
jealous of
so what?
penis. Y'all been jealous of penis sizes since the beginning. But you use those type of things to say that this individual is beneath me. This individual can't be educated. This individual can't be this. They can't develop. How do you take the fact that I'm bigger, I'm stronger, I have a higher tolerance? How do all of those attributes that you claim to use against us, how do you use that to say we're a lesser human than you, or that we're inferior to you?
Because they are number one haters. Always have, always will be.
But yeah, so they've been infatuated with our bodies since the beginning of time.
That's why they always try to strip us down. Strip you down. When I'm about to whip you, I'm gonna strip you down. I'm gonna embarrass you. We're gonna take off all your clothes and wrap you around a pole and with your legs and your hands wrapped around this big old tree. So we're gonna
Yeah.
we're gonna abuse you. We're gonna tear up your body with this whip, and we're gonna scar you up with, slapping you with this whip and making skin peel down. And that was their number one thing, because if they didn't see blood, they wasn't doing it right. They felt
Right.
like they had to pull the blood out of you in order to feel more superior. And that's when they also did it with that Bible, right?
but
You will obey your master. You will, you know what I'm saying? You
they
did that all with
they
abusing.
were raping our men and women. If
Right.
you can't beat
They
them,
were doing that to emasculate them, though.
yeah, they went
Exactly.
touching our men, women, and kids, having babies with us. Like,
And then get mad when the woman get mad when the wife of the slave owner want to look at that man like, dang,
But
okay,
that was but they consider that, white men consider that an abnormality because you was well endowed.
exactly. He looking
And
at
then
her
another
like,
thing
don't
they
look at him
did,
like that. Then they
you
got
know,
to
we
remember they
talk
started
about
castrating them
propaganda.
then. Remember they started castrating them then.
Right. We talk about propaganda. So another thing they did, not only were enlarged penises considered as some kind of birth defect or an abnormality, but what they did was they would compare. So when you look through books and you look through history, and you look at how black people have been, how we've been pictured throughout history. One of the things they did in comparisons was they would take the wealthiest of the whites, the most educated, the most sophisticated, always well dressed, presidents' wives, things of that nature, and they would compare them to the birth defects amongst blacks. So they would take so you think about today, you take 5 black women today that have cerebral palsy, Down syndrome, whatever the case. Let's go with Down syndrome. You take 5 black women, grown 30-year-old black women with cerebral palsy. You take 5 white women that look like Jennifer Aniston, and you put them in a room and you line them up, and you ask the audience which one is more physically or visually appealing. What the hell do you think is going to win that? But that's what they did to say that we were animals, we were less, we were, we weren't superior to them. They would take the worst of us and compare them to the best of them.
But they do that to this day. To this day, they will do that on a even on a scene. Something's going on, right? Like something just happened, something went down. They will go find the uneducated, bummy looking African American and go talk and interview them, knowing that there was somebody that was around that could probably tell you the story, know the story, the full story, or something like that. That's more cleaned up, more.
They do it whether they're around or they not, because you got to realize even when we pass away or something tragic happens to one of us, they always paint the story like we was so bad and we was so this and we was so wicked, and it was always something negative. It was never the positive and good stuff that was done.
There is nothing positive.
That propaganda,
right?
The narrative that they like to create for us.
You're right. But yeah, it's crazy. Matter of fact, I read a study just to prove what they were doing during these periods. I read a study that today's modern women in Mississippi, in the state of Mississippi, 1/3 of Black women in the state of Mississippi are sterilized infertile because of previous procedures. Most of it unwilling, involuntary, non-consensual. But 1/3 of Black women in Mississippi are sterilized.
Wow.
That's crazy.
That is definitely crazy. That is wow.
Yeah. They've either had a hysterectomy or they've been sterilized. 1/3.
It's crazy.
Wow.
This is another article that we had came across on the American Bar Association.org website. That just shows that there's definitely bias and racial disparity when it comes to healthcare. For people,
bias. It's known bias. It's implicit. This is. Hear me now. Go ahead.
Yeah, they basically were saying that Black people get sicker at a higher rate. The mortality and morbidity rate amongst Black people is higher. And it's because of the care that we receive from our providers. We are not receiving the same quality of health care that wonderful people receive, and that is what's shortening our lives. We talked about us, receiving this inferior health care and how we're more likely to be less likely to be diagnosed, less likely to be given the appropriate care once we are diagnosed. More likely for them not to notice the things that are wrong with us or to misdiagnose the issues that we actually have just because of our race or ethnicity.
Right. Wait. Read that. I can see it, and just hold on just a little bit because I want to. With chronic diseases, the chronic diseases such as right there. Lower quality. Yep. Thank you. Inferior physicians give their Black patients. Okay. Non-reported that minority persons are less likely than white persons to be given appropriate cardiac care to receive kidney dialysis or transplant. Because there's a lot of African Americans is always get, we always have some type of kidney something, you know what I'm saying? Cardiac, always have high blood pressure, heart attacks. Where was I at? Okay. And receive best treatment from stroke. We be having strokes. That's that high blood pressure. That's that stress that we be getting. Cancer or AIDS. There's a lot of AIDS patients that ain't getting the right medication. In concluding by describing an uncomfortable reality, some people in the United States were more likely to die from these: cancer, heart disease, diabetes, simply just because of the lack of care. Literally, y'all, these are the main chronic diseases that Africans and the people of color die from. And these are our number one top diseases. And we get the minimum.
But hold on. I'm glad you brought that up because there was another article that I read, and I was glad that American Bar Association wrote this article, and they talked about that. So these are illnesses that we see prevalent in the Black community, right? We always talk about diabetes and all that in the Black community, stroke, heart attack, all of that. What's funny is there was another study that said that even though the Black community has more genetic ailments than any other population, only 8.5% of our deaths are attributed to those hereditary illnesses. So even though we have those issues, we're not dying because of those issues. We're dying because of the lack of care that we're receiving for those issues. So only 8.5% of us that die, even though we have the highest genetic ailments, only 8.5% of us that die from those genetic illnesses or those hereditary traits.
Yep. Just
Well,
only
we some of that stuff we bring on ourselves, and we need to stop.
yeah, true that.
We're not. So I'm not gonna say that it's totally our fault, because a lot of us are not being educated on the proper things to help prevent these illnesses before they start up. Most people don't know that it's hereditary, these illnesses, until they already in the hospital and they sick and something bad is going on with them already.
That goes back to DNA. If you haven't been DNA tested, know who your folks are. Go ahead, Ross. I'm sorry, I had to throw that in there.
Oh no. It was just a side thought, and then we do bring it on ourselves a lot of times. If you know that you're diabetic and you're not supposed to have certain things, then change your lifestyle. Stop being so stubborn and focused on what it is that you want to do, and do what it is you're supposed to do for yourself, so that you can be around here for you and your family. That's my side rant.
Right. But yeah, read that article from American Bar Association. It's interesting that they conducted those studies that show that there are racial disparities in the healthcare that we receive. And it's not that we are having more issues than anybody else. We're just not receiving the care. No different from there was, and I don't know if it was in this one or another article where they were talking about, and all of us know about C19 because we all live C19. But they talked about even though in C19 more whites, because of population, of course, would be hospitalized for COVID-19. Blacks were dying at a higher rate because of COVID-19, even though more whites were admitted into the hospital for COVID-19. It had nothing to do with your body, your genetic makeup. It had everything to do with the fact that you were not receiving the care that your white counterparts were receiving when you have the same illnesses that they have. And oftentimes it's not even reported that they have those illnesses. Just like back then when they were talking about vitiligo, they just assumed that was a black thing. They assumed that albinoism was a black thing, just because it's not noticeable in white individuals. So a lot of these studies that were conducted on us is because you assume that these things only impacted us. But the reason why a lot of these things impacted us was because of our living conditions. So poverty played a huge part in this medical malpractice, but they continue to keep us impoverished. They continue to keep us in a place where we have to go through generations and generations and generations of poverty. Them pushing this single motherism is continued generational poverty. Black women, please understand that single motherism is generational poverty.
So I don't need him, and I can do this by myself and all of that. No.
Hold on, wait a minute. I did want to point out
you needed him when you had that baby. You needed him to get pregnant. So
fact. I do want to also let y'all know it does stay here again. Them Black patients suffering from bipolar disorder, which is a mental health issue, are more likely to be treated with antipsychosis. What is that? Scroll up for me.
Antipsychotics.
That's what I was going to say. Antipsychotics, despite evidence that these medications have long-term negative effects.
And they're not effective.
Exactly. And they're not effective. They give us multiple, like I said, TD is that number one. It gives you suicidal thoughts. Who the hell want to think about suicidal thoughts while we're going through this ups and down mental roller coaster? I mean, damn, it's bad enough we're going through that, but now we got to think about suicide too. I mean, come on. I mean, a lot of those medications are really not there to help us in the bipolar disorder, manic depressive, manic depressive. It's not helpful for us, period. The medications that they're prescribing is also going to have a long-term negative effect, period.
That's going to increase your chances of needing additional medication to combat the symptoms of that medication.
Exactly.
Like the doctor wanted me to have remove my tonsils because the medication you gave me was causing me to have strep throat.
No, interest.
And I'm a person that was on different types of mental health medication and bipolar medication. I'm telling you now, it gives you so many. But as soon as you start finding other avenues, stress reliefs, meditating, tai chi, yoga, just the whole Wu-Sa effort method, that's something that works. You start getting yourself off of different types of things like that. I'm telling you now, you would never have to worry about a twitch, because that's embarrassing. That is so embarrassing. Walk around with a twitch.
I mean,
Okay.
at that point, the mental health illness is way worse than the twitch.
But that,
side effects from the medicine that they taking on top of the twitch.
I'm trying to tell you, you got to back away from it. I don't care if you wean yourself, like she said, weaning herself off of certain medications does help you in so many ways. And I know the doctors always tell you, don't take yourself off of medication. Oh, you can't do this. You can't take yourself off of medication. That's not good for your health. Yeah, right. Some things being taken off is good for my health, because guess what? All these straight stopped.
Right.
They stopped. I no longer have certain issues and certain problems due to taking myself off of that.
Right. You know what? When I weaned myself, I was taking every asthma medication that ever came out. If it came out for asthma, at some point in my life, I was on it. I went through a period where they could not control my asthma. I was being hospitalized a couple times a week. I was on breathing machines. They literally could not control my asthma. Well, found out one of the reasons why they couldn't control it is because the birth control that I was taking was triggering my asthma.
What? Okay, so back to what I say, that birth control. Listen, it's something that they did a long time ago when they said they was going to start sterilizing. That's that part of that sterilization, because that birth control has so many side effects in it that tear up our bodies from head to toe. Kids, from inside to outside.
What's crazy? Right. So, but when I decided that I didn't want to be, because I was watching older individuals, and when I saw somebody pull out one of those pill separator things, that the Monday, Tuesday, Wednesday, or the different times of the day you take pill, I was like, oh my God, that is not going to be me. I decided to wean myself off of that medication. So when I made that decision, that was the last time I refilled an asthma prescription. The only thing I refill are my actual inhalers, just in case I have a bout where there's the phase where I'm having a shortness of breath.
Or induced
Do you know that when I weaned myself off of all that medication, do you know that I didn't have an asthma attack for years? Years I went. And for years, they couldn't control my asthma. As soon as I weaned myself off the medication, I didn't have asthma attacks. The only time I experienced shortness of breath is if I was sick, like with the flu or whatever, that would impact my lungs, or if I was doing some rigorous activity. But an asthma attack, ever since I weaned myself off the medication, how is that? So while you all were keeping me drugged up, I was being hospitalized constantly, back to back to back.
We're making money, money off of you.
Right. Making plenty of money off of me. Soon as I decided I didn't want to be that 80-year-old individual that was popping pill after pill after pill and had to have a pill reminder to take your damn pills, a lot of my problems dissipated.
Period.
That's why I have a huge problem or a major distrust that's not the only reason why. That's just one of the reasons why. I've had a lot of negative experiences with doctors and with hospitals, and not just with one. I'm a military brat, so I've lived across this globe. I have seen doctors in different countries. I've seen doctors in multiple states. And more often than not, the experience is a negative one, either of overdiagnosing or underdiagnosing. But go ahead, Rox.
Oh, I see a question. What can we do to fix it? Advocate for yourself. Be your voice at all times.
But go down. So this is actually a report on the birth pregnancy-related deaths. So it's the birth mortality rate. And per 1,000 live births, white women, you see the stats, look at where black women are compared to white women. But it has nothing to do with your genetic makeup, has nothing to do with your skin color, has nothing to do with the fact that you, as a black individual or as a black woman, you will encounter more problems in childbirth. It's because of the care that you are not receiving during childbirth. The reason why the mortality rate is so high. But go down. They got almost all the way down to the bottom. They got a chart of some stats. Keep going. Keep going. Keep going. Keep going. Keep going past the references. Here we go. So these are the pregnancy related more. Go back up to the
ages. Right there.
I want to see the top where you can see. I want to read what it's about. Okay, so this table is showing the pregnancy-related mortality rates, or PRMRs, and the disparity ratios by age and by group. So you can see at the top they have all the totals. So the pregnancy mortality rate in total is 16.7. But look at the age groups and look at the difference. So stay on the total line. So you can see if the total mortality rate is 16.7. The white mortality rate 12.7, but look at the black mortality rate 40.
I just wanted to scroll up. It's 40.8, but if you look at that age group breakdown, that's where you're gonna see it. You're gonna see age break.
But what's funny is look at the population between white women and black women. Black women only make up about 7% of the population. So how do we have a 40.8 pregnancy mortality rate, and we're only 7% of the population in America? How?
That's something for them. That's something for them to give us a good explanation on. I would love for someone, a doctor, to come in and please let me know if that nationality.
What genetic makeup contributes to this?
Look how high it is when it comes to. Look at that.
Look at age 25 to 29.
No, man, look at the 35 to 39, 80.75, 30 to 34, 48.6. Over the age of 40, 100, what?
Now, everybody's increases with age. And of course, you know, there's a point where you get to geriatric age where a lot of pregnancies could be complicated. So that rises with every group. But amongst black women, because we only make up 7% of the population, those numbers are astounding.
What? That's what I'm stuck on. Them numbers is
ridiculous. How is that possible when we are 7% of the American population?
Man.
But go ahead, Rox. And that just breaks it down. So it breaks it down they broke it down by different age groups. They broke it down by educational groups, which I understand why they gave the data, but education.
You couldn't tell me. You got to be very specific. And I highly doubt y'all was that specific on what, man, listen.
I just feel like if education plays a part because of poverty.
Okay.
And whether or not you have access to certain things. Of course, if you're a college graduate, you probably have a better chance of having a better job that's going to have some insurance as opposed to somebody who doesn't, especially when you compare them to somebody who doesn't have a high school education. So you're more than likely to have a job where you're going to have medical coverage. That to me is where I see where that falls into play, but it has nothing to do with the racial biases in the medical field that are contributing to these mortality rates.
It's just another number to throw somebody off, throwing in some education completed. Man, get the hell out of here. That education has nothing to do
because having a college degree has nothing to do with my ovaries, has nothing to do with my uterus, has nothing to do with whether or not I'm going to have a complicated childbirth.
Period.
Nothing at all.
They full of shit when they add a lot of, when they add a lot of unnecessary statistics and numbers to shit. It's their way of fluffing things up, trying to mask things behind another mask and try to throw up these smoke clouds. Listen, it's all about money, and pharma do care. They can prescribe all the medications that they want to prescribe. They can give you all the types of whatever, because at the end of the day, they trying to collect money. They don't care about black people and their health. Because if they did, they wouldn't always try to prescribe and diagnose you with something. They'll be willing to listen to you, what you're saying. Most of the doctors come in there, don't even want to hear what you got to say. They look at your chart. Oh, this is what you've been doing. This is what we see. Okay, keep it pushing.
Right. But yeah, so for me, education don't have nothing to do with a complicated birth. Nothing at all. Whether you a high school graduate or not, has nothing to do whether or not your birth is going to be complicated. Nothing at all. Now, it may have something to do with whether or not you have insurance. Has nothing to do with whether or not you will have a complicated birth.
And my thing is, with insurance, you are pregnant, you get insurance anyways. At the end of the day, you pregnant, you get insurance anyways. At the end of the day, whether
Right.
it you know what I'm saying, whether it's you having insurance paying for yourself, as soon as you're a pregnant individual, you automatically have insurance from the government. So with that being said, it really don't matter. At the end of the day, you get insurance when you're pregnant. Flat out.
Hey, but whether or not you got education would determine whether or not you have a high mortality rate. I'm just saying.
That's some straight
I
bullshit.
appreciate the stat. Has nothing to do with childbirth complications. Not at all. Having a degree does not change your level of complications when you are going through childbirth.
Facts. Not at all.
But go ahead, Rox. But yeah, those are CDC stats.
And again, all stats is based off of some bull crap.
And these are the different causes of death, pregnancy-related deaths here. Now, while you can see a higher number in white women, you still have to remember proportion to population. While the number may be high with white women, it ought to be. But the rate of Black women, because we only 7% of the population, is where those numbers are.
Wait a minute. Look at that. Infection. Infection most likely has something to do with the lack of care. Period, point blank. Infection has something always to do with the lack of care that they did not prevent. They wasn't trying to intervene. It's due to lack of care. And infection is the highest one. Am I looking at that right? Is that one of the highest one?
You got
the throwback. Hold on, what is it?
Embolisms are
pulmonary or embolism.
Yeah, cardiovascular conditions are high.
Okay, now that has something as well. Pulmonary embolism. That's something else due to lack of care, giving medication too much, something that you're doing to the patient to have that problem when it comes to an embolism. We just don't automatically have one of those. Pulmonary is nothing that just it's nothing that you just automatically get. It's something that you've given me during the intervening process of me having this baby or beforehand of this happening. As well as cardio. What is that? Cardio, anything with the heart? Oh, yeah, that's your fault. Non-vascular, anything that has anything, that's all their fault. That's something that could be done from them. Period, point blank. The only thing you can tell me is maybe the amniotic fluid. But again, if the amniotic fluid is still within me and you see that you didn't clean me out, again, at the end of the day, that's still malpractice. You know what I'm saying?
And all of it was violations. All of it was violations of the Nuremberg Code. All of it, because the Nuremberg Code specifically states that for any experiment, the patient needs to be voluntary. The subject needs to be voluntary. Not only do they have to volunteer their services, but they have to be made aware of all of the risks that come with this experiment, with this test. Anytime somebody is not made aware of all the risks, that is a violation of the Nuremberg Code. That was the biggest problem I had with the vaccine that came out. I'm like, okay, it's no secret that these are human trials. It's no secret because mRNA interference had never been used in a vaccine before. So there's no secret that these are human trials. But because everybody wasn't made aware of the possible risks with the vaccine, with everything that was reported in the VAERS data, that was a violation of the Nuremberg Code, in my opinion, because these people were not made aware of the possible complications that came with this experimental vaccine. Same thing with these experiments. None of this was consensual. If you don't have the right to refuse, you cannot grant consent if you don't have the right to refuse.
But in 21st century, y'all got the right to refuse. So if it doesn't sound good, it doesn't
Not
sound.
all the time. Not all the time. Because, like I said, slavery died in name only. Prison industrial complex. This is nothing but rebirth slavery, just with a different name. Because everybody in prison ain't no criminal. And a lot
Absolutely.
of the female population, the black population is being sterilized because once you a felon, you no longer have any rights as a human. So you can't make those decisions for yourself. So yeah, a lot of the women in prison have been sterilized. They've had involuntary hysterectomies.
A lot of them is walking around pregnant as well. So yes, it's you got ones that's walking around pregnant, and you got ones that's getting sterilized. I absolutely understand, but at the end of the day, you if you can advocate for your health, by all means, do so. Research as much as if they tell you you have this, you have that. Research it. Research it. There's nothing wrong with researching and getting a second, third opinion. I don't trust everything one doctor will tell me of one race. I believe in asking some folks that don't even speak my language. I'm willing to ask them. You know what I'm saying? The way I see it, the more resources I utilize in asking questions, researching myself, I don't care if I go on Google. It helps out. You know what I'm saying? It all helps in saving my own life as well as someone else's out here.
For sure. For sure.
Because I know my dad and his situation, it was crazy. Because I told you that they told the one hospital said that he is no longer a candidate for that treatment, but yet as soon as we got him out that hospital, guess what? Oh, he's a candidate at that hospital. So yeah, I'm still trying to figure out what happened. How did he become a candidate? And how did he not become a candidate over here at this hospital, but at this hospital now he's a candidate? What happened? And it's honestly the lack of care that he was also getting there that I'm very upset with. So yeah, y'all better be watching out for this face, because I'm coming for you for real, for real.
So it's a touchy situation all the way together. Most people that come on the show know that I was pregnant and I just had a little baby. So I had an issue when it comes to medical malpractice, dealing with the hospital that I had my baby at. What happened was they were giving, I was supposed to go in for a natural birth, and they did not. I didn't end up having a natural birth. They ended up telling me that I needed to have a cesarean after I was in labor for a little over a day. So they performed a cesarean.
Did we lose you, Rocks?
No, I'm here. I'm still here. Can you hear me?
Yeah, you just froze up. Okay, there you go.
Okay. So they performed a cesarean, and in the midst of them performing the cesarean, nicked my bowel, and so my colon and portion of my intestines started dying, and I ended up having to have emergency surgery to resect my colon or cut off portions of my colon that had died and put my intestines and stuff back together. So the problem that I had with it is the malpractice that I received before I actually ended up having had emergency surgery, because they told me that if I wouldn't have had emergency surgery, I would have died. They said if I'd have waited a couple more minutes from having surgery, I would have died. But that whole day, I kept telling them all day long that something was wrong and that I didn't feel good. Something was wrong. I felt like my stomach was getting ready to explode, and they weren't listening to me. They kept telling me that that wasn't it, that I had gas, that they were going to give me the tube down my nose.
Not
And
the gas.
yeah, they told me it was gas. And they told me that they were going to put the tube down my throat in order to be able to relieve the gas pressure. And I kept explaining to them that's not what it is. I done had gas before. I got 7 kids that I done birthed myself. So I know good and well when something is wrong with me when it comes to labor, delivery, childbirth. I know when there's an issue, and I'm having an issue. If it wasn't for my husband standing up and advocating for me and getting upset because we kept asking for a CAT scan and they weren't giving us one, If he would not have stood up for me and advocated and said that we weren't taking no tube and that we needed a CAT scan, then I would have died right then and there because they were not going to give me one. 10 minutes after they gave me the CAT scan is when they found out that my colon was dying, my intestines was dying, and both of my lungs had collapsed. So I had the two surgeries and ended up being messed up for a little while. I was on the walker for a while. I'm still recovering right now. And plotting my next move. I had my baby, what turned into what was supposed to be a 4 to 5 day hospital stay, ended up being weeks, and ended up being 2 emergency surgeries and costing me a lot of other things that I generally would have done or had planned for myself. So yeah, first time I was able to tell that story without crying, y'all, because usually I'd be soft and I'd be crying. And then it's still kind of recent too. It's something that just,
Right.
it happened to me in July. So it's something that I'm still going through, still recovering from. So before then, I don't even think that I thought twice about going into the hospital. And now at this point in my life, I don't even want to ride past the hospital. Like the
Say
thought
that.
of the hospital is stressful and scary to me. Never did I realize that I was going to have other people who would have my life in their hands in that manner and not be able to control it. Um, and it was truly traumatizing, like truly traumatizing. I'll never look at the healthcare system again the same again at all.
Hey, I feel you, and that was part of the reason why we took a break, because of the complication that she was having, and we just couldn't focus, knowing that one of our sisters was going through that, and it was a heartbreaking story. I literally could not believe what you had to endure after with childbirth, and it is sad. And a lot of us have horror stories that don't necessarily have anything to do with childbirth. My horror story is the fact that I wasn't able to have a child. Um, everyone knows that I'm an advocate for child support reform. Well, it started because of my inability to have kids. So in my early 20s, I went to this phase where I was trying to have a baby and I couldn't. And I had gone through countless doctors in different states, different counties, different zip codes. And nobody would tell me what was wrong. The only thing I ever got from multiple doctors was you have an irregular cycle. So they would always try to put me on birth control, and I would tell them, hey, I don't want to be on birth control. If I'm trying to have a child, what does me being on birth control, how does that solve that problem? But doctor after doctor after doctor after doctor just kept saying, it's just an irregular cycle. Well, I know my damn cycle's irregular. That's why the hell I'm here. I came here because my cycle's irregular. If the only thing you can tell me is that I have an irregular cycle, then what the hell do I need you for? But years and years later, I'm still trying to have a child, going through these emotional ups and downs, these fits. What's wrong with me? Why can't I? Nobody's able to tell me. It wasn't until I was about 34, 35, right around that geriatric age, that a doctor told me that I had PCOS. And for anyone who doesn't know what PCOS is, it's polycystic ovarian syndrome. And what it means is your body produces more testosterone than it does estrogen, and it doesn't allow for the development of eggs like most women do. You're supposed to drop one a month. Well, my body doesn't do that. So, but what bothered me is once they found out what that was, the first time it was reported to me is, of course, during that geriatric age, where if you get pregnant now, then you stand a high chance of having an abnormal childbirth, a child with a defect, things of that nature. So I'm like, okay, that in and of itself was devastating news. Well, after that, I started going for more testing. In going for more testing, I found out that there are stages to PCOS. I was in the stage of PCOS that the only thing that they could do to correct it was to have me to have a hysterectomy. So again, we're back to not being able to have kids. So you tell me that it's in stages, and you tell me that I'm at the point where the only thing, the last stage, where the only thing that can correct it is to have a hysterectomy. How have I gone to multiple doctors? I've gotten more than 4 or 5. I've gotten 10 different doctors to tell me the same thing. None of them identified that there was a problem that could have been corrected earlier had they identified this problem earlier. So they weren't properly diagnose me. They were just telling me that I had an irregular cycle. It wasn't until I was at the stage where they could do nothing about it that someone told me that I had PCOS. So ever since then, well, really before then, but I've had a horrible journey with my experience in doctors, and I just could not believe that it took this long for you to be able to tell me that, and you tell me that at a time where the only thing you can do to correct it is for me to have a hysterectomy. So again, like I said, I'm back to not being able to bear children. So that was devastating in and of itself. But what really got me to thinking was when I read the book called Medical Apartheid. So going through that ordeal, I went through emotional phase after emotional phase after emotional phase, not being able to have kids. Well, when I read the book Medical Apartheid, in reading about all the histories and everything that women go through, reading about all the involuntary sterilizations, made me think back to I've only had one medical procedure my entire life. That medical procedure was when I think I was 7 or 8 years old. I had a bladder that had a tear in it. And of course, I went to the doctor, they stitched it up or whatever the hell they did. I'm not even quite sure what the hell they did. I remember being under anesthesia, and I remember waking up and the problem was supposedly fixed. When I read the book Medical Apartheid, I always felt different after that procedure. I couldn't explain it. I just always felt different. And my cycle had been irregular my entire life. The first cycle I had was an irregular cycle. After reading Medical Apartheid, it made me wonder if I had been a victim of somebody that had been involuntarily sterilized in that procedure.
It's crazy because I kept saying that. I kept saying that, like, sis, that sounds suspect as hell. But I remember I went through very, very similar, but I had a whole bunch of other issues, you know what I'm saying, growing up. So I was one that by the time I turned 17, I had 3, 4, 5 extra stuff that was growing inside my body, like extra. So you got cysts growing inside your body and you don't know what's wrong with you. You just know that. Remember the movie Thinner by Stephen King?
Mm-hmm.
Man, you talking about going to the hospital talking about I'm thinner. I'm like, they was not comprehending me. Like, no, the movie, like Stephen King, I swear I'm going thinner, y'all. Like, they was not listening to me, and they like, she going crazy. That's all it is. Your daughter crazy. They didn't care. I was just going crazy. I'm trying to tell them that I'm one of these people in the movie, and I'm going crazy. But that's the only way I can describe to y'all that I done lost 30 damn pounds in 1 month. In less than a month, I done lost 30 pounds. So there ain't no way my size, 10s ain't, they sliding off of me. You know what I'm saying? I'm down to a size 4 and I'm still deteriorating, y'all. I'm still telling them like, bruh, I'm thinner. I had multiple cysts inside of me and no one caught it except for an older guy. And I say, thank God that man saved my life because I would have been dead. But he went in, he's the one that told him to give me the CAT scan, give her the MRI. Let me see what she's talking about. He the one that identified all these different cysts inside of me. And then he looked down at my uterus. Guess what? I also had something on my uterus and my ovary. Now I've been diagnosed as well as having terrible menstrual cycles, heavy flows, unregular menstrual cycles. So yeah, I've been a person that's always given that birth control. That's why I keep talking so much about that birth control, because that birth control at a young age, I'm trying to tell you. So I got diagnosed with that issue at a young age. I had a menstrual cycle. It come, it go. It's here, it's not. I might bleed for a week and then it's gone for like 3-4 months, or I might do it for a whole month or 2 and then it disappeared. I've always had irregulars. And the man said after he took out everything as much as he could, he said, you might not have babies. You might not be able to have children. Now, me being me, and I'm going to define everything somebody tell me because that's just me. I'm defiant. Yes, I am. I ignore laws of gravity, and I I'm saying? I ain't doing it. So with all that being said, I made sure I was, I just listened to some people, try to figure out some ways of having kids. Thank God I did have me some. I'm very thankful that I got a chance to have children, because that was one at 17 told that you ain't gonna have any. I ain't gonna have no kids. I ain't gonna be able to pass on. I ain't gonna have one. Okay, all right. I tried many different ways, and I had my first one, and then I had my second one, and then and even though he had passed away, end up having another one. But at the end of the day, I don't want to keep living those different types of experience of going into that hospital. So I was one that said, hey, take this out of me. I don't want no problems. I don't want no more, no women problems. And I'm still having women problems because y'all was supposed to take that part out of me, and I'm still having women problems. So maybe I still have medical malpractice going on because you were supposed to take something away, and I'm still getting it full-fledged strong. You know what I'm saying? I'm getting it now by just being associated with people that's going through these type of menstrual cycles. If I'm associated through some young women that's going through it, guess what? Bing, there I go. My body's kick into that hormonal attack. So then I'm having the same thing that these young women are going through, even after I may have just went through one. That's that irregular period, PCO. Yeah, that's what that is. Your body can hormonally connect to other people, and boom, you have a menstrual cycle. I just had one.
Hey, it is crazy because, like I said, how I went to 10 different doctors. How do 10 doctors tell me, oh, the only thing wrong with you is an irregular cycle? Like, no shit. That's why the hell I'm here, because my cycle's irregular.
Fix it.
But yeah, that was the most I got from any of them. And by the time I got a real diagnosis, it was too late.
Mm-hmm.
So yeah, I do believe that it was underdiagnosed. I do believe when you hear the stories of the syphilis experiments where they were actually not treating those individuals, even though they were telling them that they were basically documenting the progress of syphilis. Yes. I wonder if I was one of those people that was being documented for the progress of PCOS. Was I a victim of involuntary sterilization? Because those things happen. Because nobody can tell me why when I was 20 years old, I couldn't have a child. Nobody can tell me why when I was 25, I couldn't have a child outside of irregular cycle. So yeah, the medical malpractice in the Black community is real. And I don't know a Black woman who doesn't have a medical horror story.
I don't either.
And that's what's sad.
That's sad.
Whether it's about their breast, diabetes, high blood pressure, you name it. I've also been around when they actually diagnosed with hold on, what was it? I'm trying to remember what it was. Oh, it slipped out my head. It was something crazy as hell. It's like, what they say you have? Herpes.
Who?
You diagnose somebody with herpes, but the technical term is not herpes. It's herpes simplex. You know, herpes has multiple different viruses in you, right?
I didn't know that.
Oh yeah, listen, chickenpox. Chickenpox is herpes. It's just if you look up, herpes simplex, herpes zoster virus, herpes varicella. There's multiple different types. Even when you get a cold sore, that's herpes. But it's a different sign.
I knew that.
You know what I'm saying? But that's a different sign of herpes. That's not genitalia herpes. That's just a different sign of herpes. Herpes have multiple it has multiple what do you call it? Pieces. Let's say it that way. I don't know the correct medical terminology of it because there's so many different herpes simplex, like I said, varicella, zoster virus. There's so many different types of herpes. So when you tell someone that they have herpes, you have to specify specifically what type of herpes that they have. Because if you tell someone that they have herpes, they automatically assume what? The herpes, you know what I'm saying?
Sexually transmitted.
Exactly. Wait a minute. That's why they have that. What is that? Abreva for your lips? What?
Yeah, I heard about that.
You know what I'm saying? But that's a sign of herpes. Remember, if you get herpes, if you get sick, if you get chickenpox one time, it's in your system. Am I correct? It's in your system. If you get it again, you got chickenpox again for the second time, right? They don't think about that. But then
you know what? I'm glad you brought it up. That was another thing they talked about in the book.
Exactly. It's called shingles.
Hold on. That was another thing they talked about in the book Medical Apartheid. So chickenpox ain't the only thing that caused shingles either in the Black community. But if you have not read Medical Apartheid, you need to read that damn book. It uncovers a lot about the experiments. One of the things that I loved about the book was how he pointed out that every time you hear somebody Black talk about medical malpractice or talk about issues in the medical field or their distrust, they always go back to the Tuskegee experiments. He said, but the Tuskegee experiment, one of the reasons why Tuskegee experiment is so known, is so widely known, is because reparations were paid to Tuskegee survivors.
Family members.
Right. That's the only reason why. If reparations hadn't been paid, that story would have been swept under the rug like so many of these other experiments. But reparations was paid to the survivors of the Tuskegee experiments or their descendants. So but they talked about in the book how, every time somebody has an issue, they always want to bring up Tuskegee experiment. He said, but what people need to realize is the Tuskegee experiment is an experiment that was predicated by decades of experiments in the Black community, decades of research and malpractice and mistreatment and racial biases in the medical field. So please read Medical Apartheid if you have not. It will change the way you view a lot of shit about the medical field.
And if you can, make sure you got time to go check out The Color of Care with Oprah and a couple other people. I just seen it, just seen the commercial again, The Color of Care. It's like, wow, that popped up again. So go check that out. Sis?
All right. Well, definitely make sure y'all like our channel, share it with your friends, and then consider subscribing if you haven't already done so. If you want to support us, you can support us via Cash App at Melanated and Candid. We thank you guys for coming out and joining us. Generally, we do this show every Thursday, 9:15 Eastern. When we have some things come up, then we'll switch it over and we come and do it here on Saturday. So we're going to do some reaction videos again tomorrow. So if you want to come and hang out with us tomorrow around the same time, we'll be here again doing our thing. Thank you so much for coming out. Thank you, Miss Gail. We appreciate you so much.
And if anybody has not subscribed to Gail's channel, please subscribe to Gail and Knight. That is a beautiful soul. She's the best moderator out there. Yes, she has great conversations. And Gail, I apologize. I fell asleep last night. I was supposed to be tuned into your show. I was sitting on that couch after World Class got off, and I dozed off, and I didn't wake up to midnight. So I'm sorry that I missed your show last night. But it should have been an interesting conversation. I am going to go back and watch the replay about trusting mothers to raise Black boys, or the problems with young Black boys being raised by single mothers. So I definitely look forward to catching that one. Sorry I could not catch you live. But yeah, if you have not subscribed to Gail at Night, please go subscribe to her channel. She's great content.
All right, y'all. Well, we look forward to seeing you guys. I posted Ms. Gail's
that's it. Save our boys from their mothers. Yep. Yeah, I'm definitely gonna. Matter of fact, I'm gonna go sit on the couch.
Okay, let me tell you something. I'm feeling some type of way because wait a minute. Shoot, don't say.
We ain't talking about all women.
I know, so, but I'm just saying.
I'm gonna go sit on the couch and I'm gonna watch the replay.
Black men over here, y'all. I am. Don't get it twisted. I'm trying to do as much as I can, but y'all stay tuned until next time. Love y'all.
But yeah. But read Medical Apartheid.
We'll see y'all next week. I got to go catch our Melanated and Candid baby down there snapping.
Right.
Go to our YouTube, baby.
Bye, y'all. Later.
Y'all have a good one.